so we can start
Right.
exactly on time. Why don't I go ahead and kick off the introductions, especially since Dr. Asufu-Adjei has to pop off in a little bit. So this morning, thank you all for being here again, on a Saturday and spending time with all of us. Yesterday, we heard from Dr. Bressler, Dr. Downs, Dr. Pineda. We heard a little bit about people's different journeys into urology, some of the challenges they've overcome, and some of the things that are taking place more broadly across the AUA and the field of urology to diversify the pipeline, to make sure that our urologists look more like the patients that we serve. This morning, I'm really excited to kick off another similar session, My Journey into Urology, with two fantastic people that I have the pleasure of knowing personally. Dr. Asufu-Adjei is the Director of Male Reproductive Medicine at Loyola. She's on numerous DEI committees, including in the American Urological Association Task Force, as well as in the Sexual Medicine Society of North America and the American Society of Reproductive Medicine. Yahir Santiago-Lastra, Dr. Santiago-Lastra is the Director of UCSD Urogynecology and Reconstructive Pelvic Surgery Program. She was last year's 2023 Young Urologist of the Year Award for the Western section. She's an executive member of the Urology Unbound group. She has led an instructional course at the AUA on DEI and urology and the work that needs to be done, and is part of the inaugural AUA DEI task force. We're going to kick things off with Dr. Asufu-Adjei this morning, and then we're going to hear a little bit from Dr. Santiago-Lastra.
Great. And thank you so much for that gracious introduction, Dr. Andino. We were so lucky to whisk him away to UCLA. I'm sad we were not there necessarily at the same time. And of course, coming back to Michigan is always like coming home. Dr. Paholo too was, I think, almost new to Michigan, or like a year or two, I think, when we overlapped, and was really instrumental in supporting my journey into urology, as was Dr. Lee and several other people in the department. So I couldn't be more thankful for Michigan support as I entered the field of urology. So I think, my journey into urology is kind of a little off the beaten path. And I think for a lot of students here, I'm from the Bronx. I'm a second generation Ghanaian American. I don't have any physicians in my family. And I think my earliest exposure was really to like my pediatrician, who I adored. And so I think my whole life I was like, I'm going to become just like Dr. Soren. I'm going to come back to the Bronx. And that's really all I was exposed to. I would say, getting interested in surgery was a pleasant surprise. I actually gotten the feedback early on that I was too nice to be a surgeon. And I think, my mom was a nurse and stepped down cardiac for years, over 3 decades. And so I had also just even had early exposure passively to, cardiologists and even like CT folks. And so just a very different view. But I think, surgery for me kind of married a lot of characteristics I valued, like efficiency, getting things done, and really seeing the output of your work, pretty immediately. And so I think, as I progressed, I didn't really know where I was going to land, even within surgery, because I think that was already kind of a big aha moment for me. It's something I wasn't anticipating. I think surgery was also different in that, I'd say like other parts of medicine, there's not a lot of people that look like me. I think it's even more so in surgical specialties. And so when I went off to do my MPH year at Harvard during medical school, I think that's when I really just had time to reflect on what I wanted to do. I had some, kind of personal, family issues that came up around urology. For those of you who know me or may not know this, I have a lot of prostate cancer in my family. And so it was something that I think was kind of always around me, but didn't really think I would focus on necessarily, as well as even some kidney cancer as well. So I had that personal exposure. And then, as I think had time to be away from Michigan, I was just, I did some shadowing actually when I was in Boston, just to expose myself a little bit more to urology. So I think combined with family exposure, being able to shadow during my MPH year, it seemed like a great fit of sensitive issues, really versatile surgeries with really cool technology and great people. And so, as I mentioned, Dr. Lee, I remember being away in Boston and literally cold calling her. We had interacted before, and she'd always joke, like, you should think about urology. And then I reached out to her and was like, I need to apply. Urology's competitive. I'm not gonna like a freak out moment. And of course, like anyone who knows Dr. Lee, she calmed me down and we just came up with a game plan. And so I returned to Michigan, really on a mission to network with the department to set myself up in the best place possible. I was already engaged in some research, even though it wasn't urological research, but I do remember from even entering into medical school and being involved in research quite a bit. I knew that that was a strength of mine and something that I knew I could easily pivot into the urological space. And so I did that and was able to, complete a project with Dr. Lee. And I just aggressively sought out mentors. We had had the fortune of having just great mentorship within the department. And I was really, really thrilled to match into urology at Columbia, which is my top choice. Got great training there. And andrology specifically became of interest to me because I think I saw this as just being a great quality of life subspecialty. I think I had always thought maybe I would just go into oncology, just like my mentor, Dr. Lee. But I think that andrology for me was a great combination of quality of life issues, also really being able to kind of immediately seeing the benefit of what you're doing surgically and really being impactful. So I joke that I have the best job because now I help people make babies and have great sex lives. So I'm really the perfect world. And so really happy with what I do. And I've continued that now into melding that within my research. So I would say, especially for the students here who have decided or think that they're on the cusp of deciding on urology, it really has been a field for me that has embraced me for what I bring to the table. And I think has embraced the fact that we can't be stagnant, right? We have to be a field that reflects the patients that we take care of. And I think you all are so lucky to, again, have a program like Michigan, who I think has always walked the walk, so to speak. And even in the advent of newer DEI foci rather, in the last several years, programs, like Michigan, like UCLA and other places, and even like Loyola, where I am now, which has trained a ton of women in urology. I think there are programs who are really now getting the shine they deserve and, showing examples to other programs that may want to emulate the same in terms of outcomes and, future trainees. So certainly welcome anyone who, feels like they didn't go into medical school knowing urology. And I think andrology, shameless plug, we can also use a lot more people in our field. And so I think that my journey, although it wasn't necessarily planned or mapped out, I'm really happy where I landed. And I'm an early, career faculty. So there's still a lot of areas that my career is seeking to go. And I'm excited for those possibilities. So certainly, welcome anyone who may want to reach out and talk more. As Dr. Andino mentioned, just had some family matters that came up, and so I won't be as long on as long today as I anticipated. But I'm fully engaged and really, really thrilled to be a part of this amazing programming. So there's my story, and I'm sticking to it.
That is perfect. And we are going to share the emails of, all of our speakers and all the faculty that are part of the program. But before you jump off, if you don't mind throwing in the chat your email so that, those folks that are with us live today can have access to that, that'd be great.
Absolutely.
And with that, let's transition.
All right. So I just wanted to give a few plugs as far as, when you listen to someone's life story, like Dr. Asufu-Adjei, I met her as she was trying to transition from being a trainee and a fellow to becoming a faculty member. She was interviewing and kind of looking at different roles in which to start her career. And we'll talk a little bit about this as far as being, an exceptional mentee. She's someone who really comes prepared. If she's seeking your guidance or expertise, she comes prepared with her agenda as far as, what do I seek to learn from this? What do I bring to the table? And a lot of times people who have a really good vision, even if you are seeking guidance for the next steps in your career, if you can really easily articulate, you know, what you stand for, what you're setting out to do, what you'd like to accomplish with that person you're seeking mentorship from, it is so much easier to provide you that mentorship. And that's been something that she's been able to do. The other thing is I've noticed she has been able to get a sponsorship from mentors of many different backgrounds, which can sometimes be challenging, as many of you may know. And she does that by kind of finding those unique skill sets that they share in common, and finding common ground, and kind of using that to nurture that mentor-mentee relationship. I think she does it really well. Definitely someone to model. And whenever she decides to do whatever she decides to do, I'm always there to support it, because I know it's a good idea, and I know she's always gonna give the best effort. So somebody definitely aspirational. I'm sure family had a lot to do with it, as for many of us that's the case. You know, we model, our first mentors are usually someone in our family, someone who had a pivotal role in creating our worldview when we were children, which is why it's so, the earlier exposure to people of promise and excellence is really important for any child. But whoever had that influence in her life, I'm sure there were several people. Kudos to them. So I hope everything is good today, Denise. I'm a fan.
Right back at you, Dr. Lastra.
So let's see, I think we have a little bit of time. Our session ends at what time, Juan?
And we have 14 minutes.
14 minutes, perfect. So what I'm going to do is I'll share kind of my background and my journey into urology, in line with some slides that I have that, you know, for those of you who are repeat visitors to the Michigan Urology Academy may find familiar. I've given this talk previously about finding exceptional mentors and being an extraordinary mentee. I think that's really important when you're seeking to be successful in a competitive specialty like urology. Let me just pull up those slides so that you can see. All right.
Nice. They're up, visible.
Perfect. Let me just fix so you see a QR code there and the menti.com code, because we're going to do something interactive. Just to share a little bit about me from the get-go. I am from Puerto Rico. You know, Puerto Ricans always find a way to make that relevant to everything that they do in their life. And it can be low-key annoying, but it is, as far as my journey into urology, it does play into a lot of what makes me a good urologist, and sometimes even a good mentor. I'm not always a good mentor, but I strive to be. And that's because I, you know, have that background. I grew up in a mixed race family, so that was always like a very big part of my view of the world. I was the first to go to medical school in my family, but I do come from a highly educated family. Both my parents were attorneys, started their careers for a long time as public defenders and working in legal aid. So I always had a sense of needing to champion justice and fight against injustice. So that's a huge part of what defines me and what defines my goals as a physician and a surgeon. Additionally, I went to medical school in Puerto Rico. So there were a lot of barriers there that I had to surmount. I believe my medical school training was the epitome of excellence, and I learned to practice surgery in lower resource settings, and I'm very proud of that. But that wasn't always the perspective of the people that you know, that the spaces that I wanted to inhabit. That wasn't always considered something prestigious, like, doing a medical school career at the University of Michigan, in contrast, for example. So let's kind of go over some of the things that played into that. Additionally, I got interested in urology pretty late. I was nearing the end of my 3rd year of medical school, which is super late. As you all know, you have to arrange sub-internships and projects and all these things. And so I understand that scramble as well. So let's get started with that kind of background and kind of go over mentors and mentees and some of the good things and some of the pitfalls. So the first thing is I want to know a little bit about all of you. So if you don't mind, just pinning a little bit of where you're from right on this slide deck. I try to include like North America options. There are some, like Mexico, that are not on here. So if I didn't include you in this map, just go ahead and put it on the question mark or share in the chat. It's always nice to know where people are from and what places are not represented. It gives you a good snapshot of your audience and kind of what they're all about. Thanks for those of you who are participating. All right.
See someone from Canada. Awesome.
Yeah. Beautiful. There will be some parts of this presentation, Dr. Palaspatu, where I'm going to ask you to cover your ears.
Uh-oh. This
when I describe some of my not good mentor-mentee traits, I don't want you to have any of that perspective.
okay.
As I disclose my flaws.
No, oh, please. I thought you were going to disclose mine. In which case,
Oh,
we don't have enough time. We don't have enough time to go over that.
Exactly.
The meeting has ended.
Exactly. But in all seriousness, the hard truth is that most mentors don't get formal training on how to excel in this role. Poor mentoring can sometimes even be worse than no mentoring at all. So it is a really important thing to know exactly what you're looking for in a mentor and to take some time to get to know the people that are mentoring you so that you can really understand how best they can help you achieve the goals that you have. And there's going to be a bunch of different mentors. So if you get one takeaway from this talk is that there are multiple different ways to have mentors, and you should aim to have many and not just one or two. So let's do this next slide. So firstly, we start, and I can give you some of the pitfalls and takeaways on looking for a mentor. What are you looking for in a mentor? So I'm going to respond to this too. I also seek mentorship at this point in my career. I had already given the QR code, but if you go to mentee.com and enter that code, you can also join. And availability, that's super important, and we'll go over that in a little bit. Commitment, guidance, responsive, encouraging, and honesty. It looks like you all have the right goals in mind for a mentor-mentee relationship to be successful. From a similar background, really important. We'll go over some of those pitfalls in a little bit. Pushes me to accomplish more than I thought I could achieve. That's really important. If we're talking about positive things that I have as a mentor, I think I'm able to do that effectively with many of my mentees. I find that especially students who come from underrepresented backgrounds sometimes need some time to really nest and understand like what their really strong skill sets are, and unraveling that and getting to that potential can be really exciting piece of mentorship for me in particular. So thank you so much for people who've filled out this far. And mentorship is important. When not just in healthcare, but in corporate America, in many STEM fields, Mentorship is a big reason that faculty and employees state that they have left an institution or left a field altogether, is that lack of mentorship. And you can see that this has been a really big thing in the news. It's been covered, but yet little has changed with respect to that. And particularly problematic is the problematic mentorship for underrepresented individuals, people, women of color, specifically Black professionals. That has been something that has been really lacking. So important to be able to maximize those experiences and maximize those relationships so that we mitigate the problem. But it's a big one. So one thing I take away from this every year is to say, all of you are here because you already understand that importance. And if we can find ways to leverage that and have you become an exceptional mentor later in your life, that is already a positive. Denise mentioned Dr. Lee. I'm also a proud mentee of Dr. Lee when I was a fellow at the University of Michigan doing my urogynecology and reconstructive pelvic surgery fellowship. She had a really fantastic course on fellow education, and all of these educational goals and all of these strategies on how to be a more effective educator, I really fine-tuned during that experience, and that even has prompted me to, as I take over a role as residency program director, really make sure that education training and leadership training is a part of residency, because we don't necessarily focus on that as much for our residents, and it's really important, sometimes even just as important as some of the other clinical and surgical skill sets that you get during residency. So if you have the opportunity to seek a mentor that can cultivate that in you, that's going to be really important. But the reality is that some mentors are just kind of born to mentor. Those relationships just happen symbiotically and organically, and it's really beautiful when that happens. And I think that the most important thing some of you said is authenticity and just having a genuine interest in you being successful. Obviously, you can see here this mentor-mentee relationship was between a father and his daughter. And sometimes those are the first mentoring relationships that are established in your life. Certainly my parents gave that role. And it's okay to want to model some of your mentorship relationships in that way. I know a lot of people who gravitate to certain faculty because they remind them of their parents, and that's an easy relationship for them. And if that works for you in establishing your mentorship relationships, that's okay, as long as you understand the potential pitfalls.
Dr. Santiago-Lastra, I just wanted to chime in really quickly. And sorry, this just came to mind. I wanted to maybe have you talk about this a little bit. I think for a lot of us who, when we think about concordant mentorship, I know Dr. Ghani also has some research on this as well. And it's important, I think, to highlight because with some of us, there's so few of us in these fields. I think it's also important for me to highlight, I have a lot of mentors and sponsors that don't look like me. And so I think certainly for the medical students here, I think there is a lot of significance in having, that relatability, whether it's with racial, ethnic background, geographical background, but don't be afraid to have a mentoring team where people may not necessarily share those with you. There's still a lot of great dedicated mentors and sponsors who want to help. And even if they may not truly get some of your experiences, it doesn't mean that they can't help push your career forward. So just wanted to throw that in because I know in urology, for many of us, we are still, on the spectrum of having our specialty look like the populations we serve. And so maybe a little bit more challenging, but there are a lot of resources like this program where you can at least find, I think, mentors of every flavor, so to speak.
That's really true. And one of the things I will talk about in a little bit is what pitfalls can come from different mentor-mentee relationships. And when you strictly look for concordance in all of the mentor-mentee relationships, you may find that people are limited by bandwidth, because if there aren't a lot of Black women in urology, and you're a Black woman looking for that sort of mentor, that mentor might, be mentoring several different people of that same sort of background. That certainly happens to me. I think that that's one reason why it's important to have several mentors. So you can have one mentor that's concordant with you and shares a lot of the lived experience, and then have other mentors that maybe are a little bit different. And that way you can compare and contrast styles, get different things from different people, and just have that awareness that, these are human beings mentoring, and there can certainly be some archetypes and pitfalls. So let's go over them a little bit. It's a little humorous, but it reminds you to kind of notice this in different mentors. And it doesn't mean that it's a bad mentor-mentee relationship. It just means that you might want to fine-tune that relationship a little bit, or maybe seek different things from a different mentor so that you can balance out those positive and then negative attributes. So one of the first ones is Glinda the Good Witch, which is the mentor who potentially withholds important but sometimes negative feedback from you, just to keep things really positive all the time. And that can really hinder your growth, because the feedback or the negative attributes about you will come up at some point, and it's important to hear those early so you can strategize and improve. And not all mentors do that properly, because it's really hard to give feedback that's constructive. It's important to give it early and often, but giving feedback alone is something that has to be taught. It's not natural to everybody. So this is one archetype to be wary of. The other one, which I was saying earlier, is the absentee mentor. And this is where I tell Dr. Palpatu to cover his ears. The absentee mentor is really common, and it speaks to what Dr. Asufu-Adjei was mentioning, which is that some mentors, they are over mentoring. They have a lot of mentees, and may not have the availability that you were seeking. That was one of the first responses earlier in the chat about, what people are looking for in a mentor. And sometimes in the worst of circumstances, which thankfully has not happened to me, but they're just never around. And so on paper, you have this mentor who's in charge of guiding you through your career, in charge of meeting with you, taking you through a project that ends up, dead on arrival because there's just not that follow through. So it's really important to sort of see what bandwidth someone has to mentor you. Seasoned mentors will tell you and give you a sense of time, or even try to set you up with someone else who has more bandwidth to help you accomplish certain goals. But it's important for you to keep that in mind. Is this person available enough for me to accomplish what I'm looking for? Or do I need to seek this out in a different person that maybe they can connect me with? People won't necessarily always have the insight to recognize that you need a little more than they can offer. The other mentor archetype is the Mr. Miyagi archetype, which is an excellent teacher but has an unorthodox style that maybe doesn't mesh with you very well. Maybe they're a little different in personality than you. Sometimes there can be some lapses in integrity that perhaps you're not comfortable with. I've had that situation. I had a mentor who maybe was a little, his research methodology was maybe not quite orthodox, and that was really not vibing with me. But he was really fun and really sponsored me for a long time in my career. And I just realized that and realized it was not someone who I would necessarily want to do research with, but as someone who could just be supportive and I could maybe talk to about different things, that would be a good mentor-mentee relationship. So that is a watch out too. Again, mentors are human beings, and if you're caught in a situation that's a little bit uncomfortable, maybe too unorthodox for your comfort, it's important to recognize that too. We have seen and heard of many mentor-mentee relationships that can even turn into abusive. Not that that would be Mr. Miyagi, of course. He's one of my favorite heroes. The Karate Kid was one of my favorite movies when I was growing up. But, you know, that was an unorthodox style that didn't always resonate with Daniel. And ultimately he learned. But you have to know yourself too and see kind of what you're comfortable with in that relationship. And then the Miranda Priestley, I misspelled her name, but this is the highly successful mentor, super aspirational. You kind of want to be like her, but has a different lived experience and gives you dangerous advice that doesn't necessarily reflect what you can get away with as you go through in your career. And it's important to recognize that as well, that if someone doesn't understand your background, your specific background, your lived experience, they may give you advice that doesn't jive with your resources, that doesn't go with your personality, with your goals. And some people think that their template for success is really boilerplate and can be applied to different people. And that's not necessarily the case. And that's also something to recognize. So before we go into some little takeaways to conclude this, as far as how to avoid these pitfalls, how to really engage with these exceptional human beings who could potentially be great mentors, yet recognizing potential flaws, I just wanted to hear, are there any of these archetypes that resonate with you? A mentor who might have withheld feedback a little early on that would have been helpful for you, or an absentee mentor who wasn't as present for you as you wanted them to be, the unorthodox mentor who maybe is fun, but maybe a little unorthodox for what you are looking for, or the person who just doesn't understand your lived experience and gives you advice that maybe you can't perform yourself based on your own experience. So yeah, the absentee mentor is very common. It's a reason why we need to train more mentors in urology. It makes me really excited to have begun doing that for my trainees, so that they can all be exceptional mentors as well when they are in the field. Thank you so much for the responses. So this is just a quick takeaway as we kind of wrap up. These are different areas. It's not just, hey, I need a mentor to match into urology and then do research. There are so many different needs for a mentor as you go through your career, even as you're trying to plan to succeed someone in a role. I'm taking over as residency program director and have started gathering a whole host of new types of mentors for that experience. If you're planning to have a family and you need a mentor there, like, how do you manage paternity and work? Knowledge, how to teach, how to educate, so many different areas a mentor can be useful. So think about that and as you start to gather your mentors. This is a nice series of takeaways as well about where to begin. You know, the very first thing is know thyself, know what you're looking for, take ownership of what your goals are, have that kind of strategic vision for yourself and what you want to accomplish. And then, you know, don't get stuck in one ideal for a mentor. Try to amass several different mentors so you have the time to really engage with different people. These are some things that I've noticed great mentees have. So once you recognize someone who you think might be an excellent mentor, this is how you can make yourself be an ideal mentee. And I'll share what I've noticed specifically from my mentees that make some in particular really excellent, and that I hope to have all of my mentees aspire to, so that it's easier for me to mentor them. So I observe these traits from great mentees. They check in with me, so they know I'm busy. So they check in with me to just make sure everything is aligned, that our action items are done. They review actions from the last session. They give me updates. They help create a plan, so it's not just on me. We formulate things together. They book the next session with me so that we have, you know, continuity. They basically guide me along the path. I usually, you know, some of my best mentees are really in control of that relationship, and I'm there to really guide them, but they are the project managers of our mentorship, shall we say. This is just a plug for this integrative summer research program in urology. I'm not going to be present when we talk about the different mentorship programs. This came out of the Prospect program collaboration during the task force. And it's a really great program. We selected some really great students for this year, and we be running year on year. This is specifically for students who don't have a home urology residency program. And in conclusion, take away from this, pay it forward. If you have a great mentor relationship, if you feel like you have benefited from excellent mentors, I certainly have. I have countless mentors who I owe a huge debt of gratitude. Really share those. And then again, if you have failed in any way, I've struggled as a mentor in many ways. Availability has been a big one for me. I share that, don't necessarily overcommit as a mentor or as a mentee, but continue to cultivate those relationships with different people, because you will find richness in the different things that a variety or diversity of people can provide. Thank you so much. There's my email. I will also put it in the chat.
Dr. Go, nice to see you.
Good to see you. Thank you so much for taking time out of your Saturday to do this.
Of course, of course.
It's always such a busy season, like between the AUA and then you guys start interview season and sub-I season. I mean, we're full-blown sub-Is for our institution,
Oh my
but
goodness.
the visiting ones are coming soon. Like, I think for some reason they gave us the month of June off. I was like, that
Oh,
seems
that's weird.
hysterical.
Yeah, we start up in June, but yeah, May is also busy with the graduations and everything. So.
Yes. Maybe that's why they did that, because like between us, do you guys do a roast for your residents? Or they do it?
Well, not really. No, we haven't done one. A few years ago, they did do like, it's not really a roast, but it's mostly like I don't know, acknowledgement of their years.
Here we go.
Yeah,
Welcome
unofficial, exactly. Yeah.
Welcome back, everybody. All right, thank you to Dr. Thavasilan and Dr. Gupta. Certainly we'll have their emails if you guys have more questions. We're moving on to our next section with Dr. Scotland. Dr. Scotland is Assistant Professor of Urology at UCLA in the Division of Endourology. She is the recipient of the 2023 Urology Care Foundation Rising Stars in Urology Research Award. She's a member of R. Frank Jones Urology Unbound and has established the Underrepresented Resident Mentorship Program in collaboration with many of the other groups that support DI work in urology. Welcome to Dr. Scotland.
Right. Mhm. Oh, 1 second, sorry.
Did I know?
I would know how to do this by now. Bear with me, everyone. Okay. Hello. Thank you so much for that lovely introduction, and I'm really happy to be here today. I've always thought this was a wonderful program, and so I appreciate the opportunity to talk to all of the students. All right, let me try sharing again. There we go. Okay.
Yep.
So what I'm doing today is something that you probably shouldn't do. What I mean by that is this PowerPoint is going to be a little bit spontaneous and a little bit jumbled because I just love all the things that PowerPoint has started doing with respect to AI and what we can do with slides. And I thought that since this was a little bit less of a formal talk, I was going to experiment with different slide formats and stuff like that. But when you're doing a PowerPoint presentation, you definitely don't want to spread your wings. Okay, so I wanted to start by basically giving you a sense of like how I got here. And then we'll talk about how to be a mentee and also how to be a mentor, because a lot of the same skills are necessary. And what I hope for all of you is that you're moving through this process and you will become a mentor. So hopefully I can just share with you some of the thoughts that I have had over the years of doing this. So I'm actually from the Caribbean. So I'm from an island called Dominica, came to the US, eventually decided that I wanted to do medicine, but really started out because I wanted to be a researcher and thought I was going to be a chemist. So I ended up doing an MD PhD program to put those two things together. And then while there, I was really fortunate. Well, actually, even before that, I was really fortunate in college to have people who were sponsors, not so much mentors, but sometimes that's more important. And so those folks were really able to see some of the potential that I had and pointed out opportunities to me that I maybe not necessarily had seen myself. But then once I got to med school and grad school, I had a lot of really good mentorship. And I was able to take from that. Along the way, you also get mentorship that probably is not appropriate for you, and you'll find that in your travels. The thing to do is to also learn from those things. And when you end up in a position of being a mentor, maybe using some of the things that you saw in your travels to help you to be a better mentor. Okay, so I did an MD PhD. During my grad school time, I just so happened to be working in a prostate cancer lab. And met lots of urologists that we fell in love with urology, went into a urology program, decided that I wanted to keep doing research during residency, and did a sort of hybrid fellowship / postdoc. I went all the way to Canada to do that because that was really the only program doing the kind of thing that I wanted to do. And then I took my first position as an attending, and I'm at UCLA currently. I have had a lot of mentees. I've been there for 4 years now. I've had a lot of mentees, mostly medical students, but some undergraduates and a couple of residents doing research with me from outside, actually, of UCLA. And then some UCLA residents that I'd like to think that I at least helped mentor through their years. All right, so that's me. And I want this to be interactive. I'm gonna sort of have the screen up so I can see if people are putting their hands up and that sort of thing, but I'm going to leave lots of time at the end as well to ask questions. Okay, so I think looking for a mentor as somebody who is newly in medical school, or even if you're, sort of like midway through there, can be daunting. A lot of times there are not people doing research if you're looking for a research mentor, specifically at your institution, or if they're doing research, it's not research that you think is going to get you somewhere as quickly as you'd like to get there. And what I mean is that lots of people are doing research, but I don't know that many people understand that if they want students who are med students working with them, they need to give projects that are going to be done in a short period of time so that you can have a presentation, you can get a publication. Obviously you want to learn about research and you want to be involved in academics, but the realities of urology are that you need to be competitive. So how do you find a mentor who understands this? So the best way is to go to people who've already had mentees who have been successful. And if you can't find that within your institution, another thing to do is to go online. So Twitter, for whatever reason, I continue to call it Twitter, for whatever reason, has become the resting place for urologists. And there are lots of people online talking about their research, talking about, their presentations, talking about what they're doing clinically. And so you go online and you see who are the people who are posting, who are the people who are, always mentioning their new paper out in such and such journal, and who are the students on Twitter Who are they talking about? Which mentors are they, talking about and thanking and that sort of thing. And then you contact these people. And I'm not saying that because I'm asking anybody to contact me. I am like up to here with mentees, but you should do that, right? This is the way to find people. What you will find with time is that people who are good mentors tend to have a lot of mentees, and they've developed different ways to juggle all of those mentees and make sure that people are getting their needs met. So it's probably better to go with somebody who's done this before as compared to somebody who's newer. That said, I was newer once. And so if you don't have those opportunities, what you do is you talk to somebody who is just starting out and, wants you to work with them, and you get a really good sense of what their questions are that they're interested in, and have a very frank conversation. We'll talk about that later, how you can do that. But you want to have a really frank conversation with them that you want to work with them, right? And they're willing to take you on because they're new and they need students, but you also have to make it really, really clear that you need a very small prescribed project that will, be successful for you. Okay. And how do you navigate these academic spaces to do that, right? In order to get a mentor, you have to find them online, but you also have to figure out how to approach them, how you're going to have those conversations with them. So the way that I was able to find people was to go online and look for their email address. Twitter makes life so much easier, because what I've noticed is that in recent years, a lot of times people's official email addresses are not necessarily on Google. So you go to Twitter, you send them a DM if they allow that, or you go to LinkedIn and search for them. Typically, people will have their email address on LinkedIn, or there'll be some way for you to contact them. And then how do you navigate, the conversations around that? Okay, most people understand that medical students are, just starting out. And so honesty is always the best policy. Say hello, tell them who you are, tell them what your interests are, where you found out about them, why you're excited to work with them, and what kind of bandwidth you have to do it. Okay, so if you are in med school and you also are working, right, you have to, pay your rent, that sort of thing, and you only really have 5 hours a week, don't contact somebody who has a scientific lab and is doing that kind of research, because 5 hours a week in a lab is not going to get you anywhere, right? So you might want to contact the person who's doing online research, ChatGPT type stuff, maybe some health disparities work that doesn't require you to physically be there and do a lot of, patient interviews, that sort of thing, right? So you have to get a better sense of what you can provide to that person, okay? The other thing you can do is, if you happen to be at a conference, or you happen to be at an institution where they have an annual, most residency programs, if you're fortunate enough to be in an institution where there's a urology residency program, most of those programs will have an annual visiting professor or something like that. You can find out about those things. Typically, the visiting professor talk is going to be open to the public. A lot of times their grand rounds are open to the public, so you show up, right? Make sure that you're nicely dressed, and then you introduce yourself to people. And these are the ways that you sort of make contacts if you've not been able to do that prior. Right. And then you have to think about what kind of support you should expect, okay? So that you have a really good sense. And we'll talk about how you can have that conversation a little bit later. But the type of thing that you want is, well, first of all, you have to, we'll talk about what kind of mentorship you're looking for, right? A lot of my talk is based on assuming we're talking about research mentors, mostly because, urology, again, being very competitive, you need to get research done, and you need somebody who's going to help you to make that happen. But you may also want clinical mentors. You may also want to make contact with urologists, especially if you're not in an institution that has a home program. You want to make contact with urologists who are, just urologists, and you want to talk to them about the field. You want to get a sense from them of what to expect from the field, talk to them about their cases, talk to them about your interests, talk to them about how you can get, your hands-on, how opportunities in clinical urology, right? So what kind of support can you expect from these people? Urologists are busy, as are most surgeons. And so what you may want to expect from them is, you might not be able to meet with them every week, but, a routine follow-up with them is something that you should expect. And what that looks like for you is a decision that you would make and that you would discuss with them. Okay. You should be able to expect them to be able to meet with you and talk with you about what's been going on with medical school, what is expected of a medical student in urology. Okay. Give you a sense of what residency might be like, give you a sense of what a life in urology might be like. And then you should be able to expect advice from them in terms of how you can make yourself a successful candidate. Whether or not that person is able to give you research opportunities is a whole other conversation that you, again, have with them. But there are lots of people who can give you mentorship who might not necessarily be able to do programmatic work with you. Yeah. So going back to research, how many types of research are there? Again, I said basic research. I would only recommend basic research if you have already done some basic research as an undergraduate and you're taking a year off and it's a relatively simple project that you think you can do. And it's something where you're not doing it by yourself. There are a lot of ands in that sentence, right? Because basic research can go sideways very, very quickly. So if you're thinking about doing something like that, I'm not saying no, but I would go into a program where there are multiple people who can help you. So you're working and there's probably a graduate student or a postdoc who has a larger project and you're just working on a smaller portion of a project with that person, or you're helping them to finish up something that they're kind of close to the finish line already and they just need somebody to do some experiments with them. Okay. If it's a situation where it's a whole new project and you're starting it from scratch, I would really strongly recommend that if you are excited about doing that, then you find something else as an adjunct, some sort of clinical or computational project that would be something that you can get done in a few months and get a paper out of it. So there's computational research. If that is something that you have a background in, you can get some really lovely papers that are worthwhile, right? Sharing with people. Clinical research, there's so many different types of clinical research. I would recommend that you focus on, again, smaller projects. So clinical trials are fun, but clinical trials take years, right? Unless you're doing a very small, prescribed clinical trial. I see some of my students on here and they're doing some very small trials with me that we think are going to be, 4 months, 6 months. And these are people who are working with me over a 2-3 year, right? Timeline. So we will get papers for them. If you're on a sort of a tight time frame, don't do that. Disparities work. If you, again, have a sense of what the timeline will be. Patient-reported outcomes work. If you're working with somebody who does this work, who has a team who's helping them, qualitative research is also time-consuming. And so if you're going to get into a project that is qualitative, make sure that there's a team to support you. Okay. Systematic reviews are some of the fastest things that you can do. And then you can have lots of support there because you can work with the librarians at your school and they can get a lot of this work done for you. So that's an option. Okay, so how to be a good mentee? I think you have to set goals, all right? You have to know what it is that you want. If you don't know what you want, you're probably not going to get, unless you have, an amazing mentor who's had lots of mentees and is basically ready to just walk you through the process. You have to set goals for yourself and you have to articulate those goals to your mentor to make sure that you are on the same page. So you want to determine your area of focus. And sometimes you don't have that luxury, right? Sometimes you contacted 10 people and one person got back to you. So if that person is doing X research, then guess what? You're doing X research. But if you have, the luxury of multiple options, determine your area of focus, what it is that you find most interesting. Because the thing you find most interesting is the thing that you're going to be able to, pull time out of nowhere, right? Where it didn't exist. to do the reading and do the background work that you need to do because you're excited about it, right? You have to develop the ability to recognize whether you're going to need to acquire new skills. Okay, so you talk about the project and you figure out, do I have the skills necessary? And if I don't, do I have the time, right, to develop those skills? So if you don't already know how to do Python, right, are you going to pick up a computational project? Do you need funding? Sometimes, right, you can get funding for a project much more easily than your mentor would, because there are so many opportunities available for small research and travel awards and that sort of thing for medical students. The AUA, Urology Care Foundation, there are lots of different organizations and a lot of these subspecialty societies who have funding available for small projects. And so if you can go to a mentor and say, hey, listen, I'd love to work with you. I'm going to apply. I want to apply for this, particular small grant. That's another way. If they feel like you're coming with some money, it shows them that you're interested. And then you have to think about where you're going to present this work. If you're doing work, right, you want people to know about it. So you have to think about, are you part of the MA AUA or the Western Section AUA, or what section are you a part of? Is there a subspecialty society meeting that's coming up in your city or close to your city where you feel like you can go? And then, depending on what your mentor is doing, are you able to go with them to a meeting and network at that meeting, meet other urologists? If you're doing work, start thinking about what journal might make sense for that paper to be in. And you may not know, but these are conversations that you have with your mentor so that they know that you understand the process, right? And then the other thing is respecting your mentor's timeline, right? Everybody's busy. You're busy, they're busy. And so the way to make your meetings with them successful is to prepare questions ahead of time, stay on topic, and make sure that you regularly schedule meetings with them and you keep those times. So if you guys meet once a week, once every other week, once a month, make sure that you make the most of that time. So what I used to do is I used to actually go into my meetings with I always write. So with my little notepad, and I would have a list of things that we would go through. If there was a meeting that I felt like we had to get through a lot of stuff and I know I only had half an hour with that person, I would send them that list ahead of time and tell them, these are the things that I'd like to discuss. So then you don't sit with them and, get, off topic with them, giving you this story about their dog that they took to the wherever, right? Because these things happen. You go in and they're trying to build rapport with you, and then they spend 10 minutes chit-chatting about something and you only have 20 minutes to go through 10 things. So if you let them know ahead of time, you can keep things on track. Keep your mentors up to date with whatever progress you're making, but also difficulties. So don't wait a whole month to tell them that the Python script that you've been working on, right, is giving you problems. And then expect and accept constructive criticism from them. Okay, so you have to determine what your goals are. And I think for, being in med school, trying to get to residency, some of those goals should be the following, right? Getting guidance on that path, getting tips on clinical expertise, making sure that you're able to develop a project, but also making sure you can develop some foundational research skills, especially if you think as a resident, you're going to want to do research. Hopefully publication, but if not, then some presentation somewhere of your findings. And it may be as simple as doing a, med student research day at your school, right? And developing potentially a longitudinal relationship with that person. Okay. The mentorship should be ongoing. And what I mean by that is if you're, say, an M1 and you happen to get into a summer research program, that is a person you should be looking at as an ongoing mentor for you, that you're keeping in touch with them throughout your M2 year, throughout your M3 year, so that by the time you get back to wanting letters, that person remembers who you are. They feel fondly about the time that you spent with them. They have a sense of how you've progressed through the years because you've been giving them updates, right? And then you want to get techniques from them for how to persevere, right? Through medical school and into residency. And try to, get some structured support from them. So, every so often you're going to contact them and let them know what are the things that you're doing and what are some of the things you'd like to talk to them about, okay? You want to get an understanding of their field if you're doing research with somebody. So my recommendation is do a literature review first. So if somebody tells you, hey, I'm working on, I do kidney stone research. So I tell my student I'm working on kidney stones and I want to get a project together looking at what are the supplements that people use for kidney stones and how effective might they be. You want to do a literature review on that. Who's already done this? Has anybody written about this? Are there meta-analyses or are there actual like primary papers? And then learn the language and conventions of the field, right? Read papers so that you know that FPMRS is no longer FPMRS, it's now ERPS, you know, that sort of thing. And then try working on time management. I tell people to try to tackle one thing at a time, and it's easy for me to say that, right? But you're already in med school, you already have all these other things going on, and so you have to find a way to, if you've got a Saturday afternoon and 2 hours on that Saturday afternoon, just sit and work on one thing, and then you can do the next thing. Trying to juggle a lot is a really easy way to be mediocre at all of those things. And then learning how to delegate and working in a team. If you're working in a team with undergrads, maybe working with an undergrad who has a little bit more time to do some of the background stuff that you need to get your project going. Or getting together with other med students and deciding, hey guys, we're gonna all work on this project, which means we all get on the paper, but guess what? The paper actually gets done. Be meticulous about the process. The way that you impress people, especially when you're trying to do research with them, is being very detailed in what you're doing. I try to talk to my students about giving me protocols ahead of time, giving me outlines for papers that they're trying to write, you know, doing literature reviews so that they know what they're talking about. And you want to be really clear with that person about the aims, right, of the work. So the mentor should be telling you what they want you to do, but you should also tell them, you know, how you think you're going to get these things done. And that's true for mentors, that's true for collaborators that they may be working with or that they may have you work with, and other people in the research team. So if you're doing team research and you're working with 4 other med students, make sure that everybody's really clear on what they're bringing to the project and what the timeline is. And then know yourself, right? So I've been sort of leading towards that. Recognize your strengths, okay? And if you have weaknesses, which we all do, recognize what they are and find folks to help you with those weaknesses, right? It doesn't make sense to spend 6 months trying to learn Python when one of your colleagues already does it, right? When you can do something else and be more productive that way. Okay, so the 2 of you work together. A couple of, coming to the end there, a couple of practical tips for becoming a great mentee, and that will lead to you becoming a great mentor eventually. Like I said, outlines. I swear by them. I tell all my students to do them. I think they're really good to help you figure out what you're doing, to help you organize your thoughts, and to help you get those thoughts across to your mentor. Okay. Sending deliverables with several days notice. Please do not send an abstract to your mentor the day before the AUA deadline and expect them to really give it the time that it deserves. What will happen is they'll take a quick look and they'll tell you, okay, sure, send it, right? If you had you sent it 3 weeks prior, they'll take a look at it. They'll realize that there's all this editing that needs to be done. They'll work on it. They'll get it back to you. You'll get it back to them. You know, 3 drafts later, it's an amazing abstract that gets accepted. A lot of times it's not the research that you do, it's how you present the research. Track changes. This is a really, really practical tip, but if you're writing a paper or, you know, allow for track changes so that people can follow through. They can edit things, they can go back to previous versions, that sort of stuff. I've noticed a lot of people sending PDFs for things. I'm not sure why that is. If you're working on, assume when you send a draft to your mentor that they are going to want to fix it because nothing is perfect on the first draft. So send them a Word document. It's really easy to do track changes and edits in Word. It's not so easy in PDFs. And then be prepared for meetings with collaborators. What I mean by that is if you're meeting with collaborators, I would put a PowerPoint together and send it to your mentor. They may not use it, but imagine if they're busy and they're like, oh my gosh, this is great. Like you put together a PowerPoint already so that we can tell them where we are and they can see what we've accomplished since our last meeting 3 months ago. What you want to do is to do things where your mentor is like, this person is going above and beyond, right? We already have a writing session, so I'll just start with a really quick writing to make sure that you use outlines and confirm and reconfirm the plan. And then I don't know if we're talking about this anywhere else, but please don't get caught off guard. Stay on top of what's being published. You know, it's also going to impress your mentor if you say, hey, we've been working on this project, but somebody just published something that's really related and I just saw it. And what do you think? Right? They know that you're actually interested in the work. Talk to your peers and near peers about what's going on. Please make sure that you do a plagiarism checker. You know, I just had a conversation with my students about this. Sometimes you just pull things and you don't even know where you pull them from. Do a plagiarism checker before you send it to your mentor, so they don't have to do one and, you know, find some random, you know, mishap. And then an easy way to make sure that you and your mentor are on the same page is to do a compact. There are hundreds of these online, and you don't necessarily have to do it if you feel like it's way too formal, but maybe just do it for yourself. Sometimes you have to write things down so that you know what it is that you expect from a relationship, even if you don't have that signed and written with your mentor, but then you know what you're expecting. And so based on the fact that you know what you're expecting, you're going to approach that relationship a little bit differently. All right. I'm going to stop here with just, you know, a small word on cultural competence, right? A lot of times, you know, for students, you may not necessarily be in a mentor-mentee relationship with somebody who comes from your background. And as well-meaning as people can be, there can sometimes be things that are missed. So having honest, respectful discussions, right, about things is the easiest way to just make sure that you continue to build on that relationship, having empathy and understanding that not everybody's going to understand, right, certain things in your background. So you have to sometimes explain to people, okay, why something happened, and just continue to be communicative with your mentors. Okay, so we have a little bit of time. Oh, no, we don't. We have
No,
one.
that's okay. We can do it.
Okay, but wanted to, you know, have a little bit of time to answer any questions that you might have.
Do you have any advice on how to push a project forward? If you feel like your mentor is kind of being a little slow to respond and you're trying to get something published?
Right. So you have that conversation with them. You send an email and you say, hey, Dr. Smith, thank you so much for, you know, your time. I know how busy you are. I was really hoping to stick to a timeline of having a draft of the manuscript to you by March. Does that seem reasonable? And then again say, you know, just because, you know, as we discussed, so you're talking to them at the beginning of your conversation with them, and, you know, they need to have a sense of when you're graduating, right? And that should then say, you know, you want a paper, you want a publication. That publication needs to be done by, you know, the summer so that you can have that for ERAS in September. They should know this, right? If they've not had a lot of mentees, you maybe want to have that explicit conversation with them so they know what your timeline is, right? Because a lot of people who are sometimes pulling in students, you know, every couple of years they have a student, they may not necessarily realize that, you know, you need to have publications. You can't just say you did work with somebody. People are looking for publications. And so you tell them, hey, you know, it's getting kind of tight. If you feel like you are not able to get the work done, like I said, pull somebody else in, send them an email and say, hey, you know, I'm just trying to stick to this March deadline. And I realize that I'm in the middle of my surgery rotation right now, and I'm having less time than I thought. Can I bring Susan on board because she has a little bit of more time right now and she can work on this portion of the project? And so that person sees that you're trying to be proactive as well. Right. And if they don't like respond, then you start working. So send them an outline of the paper and say, here's the outline. And if they, you know, give them a couple of weeks and send it again. And if they don't get back to you, send them an email and say, hey, I know how busy you are, but are you able to sort of meet with me? Can I come to your office if you're, you know, on the same? So you just have to keep harassing them. My students are really good at this. They know to just keep sending me emails and keep texting me. It's not that we don't care about you, it's that we're busy. And so you sometimes have to remind us 3, 4, 5 times.
Great, thank you.
And sometimes you kind of need to know where you are in the schedule, like when the AUA is happening, what's happening. Like, for example, we use statisticians and they have other projects that they're on. So we need to make sure that we are respectful of their time too. So that's probably something you want to do like months ahead. Like, okay, here's the timeline. Like, this is the slot you're going to get. And we have to live in that slot because, you know, that person has other responsibilities. So unfortunately, it does require a lot of planning ahead. Trying to do things at last minute, really, we will do our best to help you guys out. There's no doubt, but sometimes it's a challenge.
You know what? Let me piggyback off of that because I think it's hard to know what you don't know, right? You're a med student, you're trying to do research, but some of these are things that you would not think about. Like I remember being, you know, an undergrad doing research. You just don't know sometimes. You don't know that a statistician might not necessarily be able to get stuff back to you in a day. And so what you can do also is put together a timeline and talk to your mentor and say, does this seem reasonable? Is there any step in this process where you feel like it might take longer than I'm thinking? And then that might jog their memory to say, oh, you know what? This is a qualitative project. My research coordinator is gonna be like off for 3 months because he's getting hip surgery, right? Or you know what? A focus group is going to take a little bit longer than you're thinking, you know, that sort of thing. And so that way, you know, you get them thinking a little bit more in detail about your project. Because what may be happening is they're thinking about it on a surface level because they've got 5, 6 other projects. So if you go with a timeline and tell them, does this make sense? And not just does this make sense and have them do a quick look, but say, you know, I've allotted 6 months for this part. Does that make sense? Is there anything in that, you know, part of the project that you think might take time? And sometimes it's hard to tell, right? I'm doing projects with some of my students and I thought it was going to be a month to hear back from some of our collaborators. And, you know, 4 months later, we're still trying to like figure it out, right? And sometimes these things just don't work. So the other thing you might want to do is try to see if you can get more than one project. So if one thing doesn't happen on the timeline that you think, so have, you know, a small project that you will absolutely positively get something out of it, even if it's a review paper, right? So that you have something to show for the time that you spent.
And that's great. I was just going to say, piggyback on that, you know, don't put all your eggs in one basket. Because yeah, like you say, when you submit things like abstracts, yes, maybe one, if you submit one, it'll get taken, but a lot of the times it may require you putting 2 or 3 to get the one to go to a meeting. There are some meetings that are friendlier to students than others. The SWU meeting is one, for example, and then definitely your local section meeting. So like we're in the North Central section because we're in Michigan. They tend to take more presentations from students and have more options, as well as your local state meetings if you guys still have those.
Right. There's a lot of city meetings too. So like, you know, Philadelphia Urologic Society, et cetera, et cetera. They may not necessarily, they sometimes let students do presentations, but the other thing you can do there is just go to those meetings so you can meet different people, shake hands, you know, get your face out there. That's helpful as well. And, you know, not everybody can afford to go to the AUA. So you can probably afford to go to your section meeting, you know, except for some sections that like go to far off places. There, it's probably going to be within a couple of states of where you live.
Like New York that goes to Europe.
Yeah, we're not gonna even talk about that. It's just wild. But most places are gonna be, you know, within your set of states.
I would like to start, you know, there's 3 of them. We'll start one by one. I would like you guys to introduce yourself. And then after you introduce yourself, just let us know, you know, briefly a little bit about your background, where you went to medical school, and, you know, where you match, of course. And then these are the questions we're going to do. And let's just start introducing ourselves. And so, Iracema, I'll start with you. Tell us a bit about you.
Hi, everyone. I'm Iracema. I'm from Tucson, Arizona. Raised here and decided to stay for residency. I went to a DO school in Phoenix called AT Still University. And yeah, that's a little bit about me. Do you want me to go through the questions, Doctor?
No. We'll introduce ourselves first, and then let's do Basil. Are you there?
Yeah. Hi, everyone. Nice seeing you all again. My name is Basil Salka. Lived most of my life in the Metro Detroit area. I went to University of Michigan for undergrad and medical school, and I'm starting residency in a few weeks at Henry Ford.
Okay, staying in Michigan. And so we had 2 out of 2 staying in the kind of, I'm not going to say same home program. Urasema didn't have a home program. You, Basil, you did have a home program, but you're going next door. And May, it's talking about home programs.
Hi, everyone. So I'm May. I'm originally from Huntsville, Alabama, which is kind of the north part of the state. I was at Alabama for kind of undergrad and BA, been at Michigan for medical school, loved it. So I decided to stay for residency. So I'll be starting at UM in just a few weeks now.
Great. Guys, thank you. I'm sure some of you already introduced it before. So let's go one by one. These are the questions briefly. How many sub-Is you did? How many interviews you received? How the scramble went, just briefly, was it a headache? I mean, I think everything happens within a weekend. Did you get everything you wanted to get, or, went smoothly, or was it a big headache? And then did you receive any interviews for a program you did not signal? And then at the end, of course, how many interviews you did? We'll talk about the last, question at the very end. So May, we'll start with you.
Sure, happy to jump in. So I did 4 sub-Is total, so my home program and then 3 aways, and really enjoyed all of them. I received, I think 20 interviews total, and the scramble weekend, I think was honestly not too bad. I think it's much better run than how other specialties do it, where you get them kind of randomly. So it's kind of nice to receive everything on one day, and then that kind of gives you time to sort out and figure out and strategize the timing and the planning. And then I actually only applied to 4 additional programs outside my 30, and I did not receive any interviews for those 4 programs. And I did a total of 19 interviews. My busiest week, I think, was probably 5 interviews. I had 2 that were like double stacked days. And I think those are the hardest. So when you're looking at scheduling your interviews, it is pretty tough to go all day long. And yeah, so I guess total I did about 19.
Well, so let me go back to that one. So you did 5 interviews in 1 week?
Yes. So my weeks ended up being really stacked. So I'd have like like one day with 2 interviews and another day with 2 interviews and then one every other day. But I had weeks where I had no interviews kind of in the start of the cycle. So it was a bit of just kind of how mine fell. I was able to kind of stack them together. And I did them about a 3 to 4 week time frame.
And since you already touched on that, let's say you had, you selected interviews for 2 programs on the same day. You received interviews for a program on the same day. How programs were how did it go when you asked for a different day? It did go well, or it was difficult?
Yeah, no, that's a great question. I was definitely stressed. I remember being stressed during Scramble weekend because there were 2 programs I really wanted to talk with, and I'd received, when they first release it, they don't always give you a time. So it's not always like, oh, you're the morning of, 11:15. Sometimes they just say like, you're given an interview on 11:15 and you'll get the times later. And so I was actually able to reach out to a program and say, I'm really interested. I don't have the full information on, like when would this be on which day. And so I was able to actually kind of schedule a morning and an afternoon. But that did take a little bit of coordination with the programs. The programs I worked with were all great. So I didn't have any problems, but I did hear people that worked with less flexible programs and had conflicts that they weren't able to resolve. So just something to be aware of. Sometimes it doesn't work out, but I was fortunate in that my programs were really kind.
And last question, May. So you actually did a morning interview in one program and an afternoon interview in a different program?
Yes, I did that for, I think, 2 different
that's what I heard.
It's
sometimes it goes that well, or you have to, you don't have sometimes a plan B. Programs will not give you another date. So great. So Basil, what about you?
Hey everybody. So I did 3 sub-Is, 1 at my home program and 2 others in the Midwest. I applied to 30 schools. Out of those, I got 20 interviews and I accepted 18. All of them were within my designated geographic preference that I put. My busiest week was 11 interviews over 2 weeks. So I had a Monday through Saturday, Sunday off, and then Monday through Friday. And it does get you thinking that when you make your signal lists, like really make it places that you're excited to talk to. Because in the beginning, I didn't imagine being so tired, kind of going to interviews like that. I think I hit everything.
Yeah. Could you comment? I'm gonna query you a little bit more. So when you were interviewing in the morning and in the afternoon, how many times you had to do that so that we get an idea? How many times were you interviewing in program A in the morning and program B in the afternoon?
I think
Does
I
it
only
happen
had one
once?
day, only one day like that.
Okay.
For me, it was more spread out, but just over a few weeks. So there would be like 1 week where I'd have 1 or 2 interviews, and then I had that 2 week stretch that really, I think, was a bit more tiring.
Okay. And I forgot to ask, but tell us about the nighttime or the afternoon, evening time. I know there's programs that, will invite you for, a Zoom layback kind of session with residents or sometimes even some faculty. Did you have a problem to attend to all of them, or were you able to meet all of those, invites?
Yeah, I think earlier on in the interview season, I was really good about going to every single one. And I made sure to go to the meetings that were for programs I was really excited for. I think near the end of the season, just because life happens and you might have like family obligations in the evening, it was a little bit more difficult. I think I may have missed a few.
Okay.
But I did think it was a very valuable way of seeing how the residents interact with one another. I think like a general advice would be, every program you'd find the attendings talk about how much they love their residents, and the residents all talk about how close they are. But I think you really get to see it with your eyes and make your own judgments when you're in that kind of more informal zone and just seeing how they interact with each other, how happy they look, how laid back they may be.
Great, great. Thank you for sharing.
Yeah.
Iracema, your turn.
I did 4 sub-Is. I did not have a home program. The University of Arizona is the closest urology program to me. So I did 4, and 2 in Michigan, 1 in Arizona, and then 1 in Texas. 2 of those were very close to family. I received 27 interview invites. I think I ended up doing 16 or 17. The scramble, so the weekend after you get the interview invites, it is a little bit stressful. There was programs that I wanted to get an interview at and based on a wait list. And then I got off a wait list on a lot of those programs. And then I was able to kind of, decline maybe programs that I wasn't as interested in or didn't have any connections to. We can talk a little bit more about that if you guys have any questions. I did receive interviews for programs I didn't signal. I think it was like 6 or 7. And I think I only ended up taking one of those interviews programs I didn't signal. So the reason I'm saying that is because 30 programs to signal is a lot, and it's hard to be really enthusiastic.
Can you explain what the scramble is, especially for those who've not gone through it?
Sure, yeah. So, and this is regarding the weekend after we get the interviews, correct?
Yes, I mean, I can take that one, but those dates will be released in the SIU website, the Society of Academic Urology. Everybody will know what the match day will be. Everybody will know when you have to submit your application, and those dates are, sacred. Another date you have to have in mind is when they release interviews. So the interviews are released on a single day. Back in the day, it was chaotic. So right now it's very organized. On a Friday, usually you will receive whatever number of interviews you will get. I don't remember at what time. I don't know whether they come all at the same time, but they should. And then you have all weekend to say yes or no, communicate with the program. But I think that at that point, you just say yes or no. And then after you say yes or no, you have, I don't know the details, but you have a few days. That's what we call the scramble of accepting, negotiating morning versus afternoon. I don't know the details of that, but after those 3 days, if you deny one, then somebody who's on the waiting list will accept. And I don't know if you guys have more insight on it.
Yeah, that was something I was worried about. Like, for example, I got off the wait list of some programs, and then there was a conflict with a interview that I wanted to do at another program. And so there is some communication that kind of goes back and know that you're trying to schedule all these interviews. And I felt like everyone was very understanding. Like, hi, I actually can't do this date. Do you have any other options available? And the program coordinators were very forgiving and very understanding. And then my busiest week, similar to what's already been mentioned, I think I had 6 in 1 week, and that was a lot.
Wow.
I'll add that a lot of the coordination with the program coordinators, every program seems to have its own system. So some people you'd message them through the portal. Other people you just email them to like an email they provided. So that's something you just kind of check your email and check your portal over those few days and just go through, whatever they would like. In terms of just like metrics to have something to look at, I was put on two wait lists. I got off one, I didn't get off the other. So that was my experience with the wait list.
Good. Well, thank you, guys. I have another. Let me see if it goes in here. Yes. So interview day. Just very briefly, I'll start with you, Irasema. What went well, and what could have gone better? And if you can share a little bit of, I believe you match where you're in Tucson, you match University of Arizona. I don't know what it was in your ranking list, but we don't want to detail. But if you match there, something went really well there. Can you share what went really well with the place you match, and what could have gone better on a place you would have, I don't know if it was your number one, but on a place that maybe you didn't do as well. If you can, share a little bit of insight of your experience.
Sure. So I think that there was a few programs that were, at the top of my list that I really loved. And I made sure, I think it's okay as an applicant to make that known. Just like we love to hear, that we like to feel like a program is interested in us. I think it's okay to say, I really want to go here for XYZ reasons. And when I, did my sub at U of A and interviewed, I made it very well known that it's from Tucson, that my family was here. My mom lives I could probably bike to her house from where our main hospital is. So all of that was very important to me, and that really shines through in your interview. So just be genuine about your. It was a lot harder to do that. Programs like really far on the East Coast. Like I had an interview at a program in Maine, and it was like really hard to be like, I love this program for XYZ because I've never been to Maine. I grew up in the desert. Nobody there speaks Spanish, right? So I think that was one program where I tried to connect with the faculty a little bit on other things, but I think it really didn't come across as genuine. Stay true to yourself. I think that's like the biggest piece of advice I can give you. It's okay to show that you're interested.
Thank you. Thank you for sharing. May, what about you?
Yeah, so I really enjoyed the interview process. I think they were a lot more conversational than I was maybe anticipating. And so it ended up being a lot less formal and stiff of a process than I was expecting, which was really nice. I think the programs I really connected with, I think Irasema makes a great point about just really being genuine and having like really good reasons as to why you're interested in a program. It always made the interview days go much, much better. I obviously like had an interest in all of the programs I interviewed with, but that interest varies. And so I do agree that it was harder in some that I was less connected to geographically or had less interest in to kind of like have that emotion when I was interviewing. I'm trying to think, there were a few questions I got that I just like kind of were out of left field. And I think that that's something that you're going to get with every interview process. You can prepare and pair, but at the end of the day, there's going to be things that you kind of weren't expecting. So I think some days I just had days where I was like, that question could have gone better. Like, I didn't love that answer that I gave. And that's okay, because you're interviewing with probably 15 faculty, right? So even if you feel like you bombed a question, like it's probably okay. And it was fine in the programs that I think that went through it. So I think that was probably the hardest part. It was just like sometimes you get that unexpected thing that you're like, like that didn't go quite right. But I think for the most part, they were very conversational, very relaxed, and they truly were excited about our applications, which was great.
Nice. Basil.
Yeah, I would say interviews are a lot more, I felt, about like personality and connecting than anything like scary in terms of like academic. So it's a bit more laid back than I expected. I would say I felt more confident in myself and enjoyed my day more in programs that I had a connection with already. Or maybe I knew a student that had done a sub-I there and told me about their experiences if I had gone on the phone with the resident, or if I had like a faculty member that I trusted that like knew people there and told me about it. When that happened, I like came in with some context more than maybe what I just learned online. And that made it easier to know what questions to ask, to be excited about the program, to like enjoy mutual connections and whatnot. So sometimes when you're going into a program blind and all you've learned is really online or like very distant context, it could be a little bit more intimidating for the interview.
Great. These are great insight. And then lastly, my last question for you guys is that who did you practice for interviews? Because if you were in a sub-eyes, some sub-eyes like we used to do, we had a very informal, you know, in-person one. But we all know the formality is now they're all virtual, and this year they're gonna stay virtual. So who did you practice with? And Basil, I'll start with you, and then May, and then Irsim.
I had two meetings, one with a resident and one with a faculty member. And both of those I went in prepared with certain answers already, and then we just did some quick like practice and got their feedback. That's how I practiced. And then truthfully, you know, you kind of go to your first interview with jitters, but once you get one or two interviews down, you kind of get into a pattern of what kind of questions to expect, what your answers are. Like that question of like, tell me a little bit about yourself. You're gonna get that question maybe 10 times a day for a month and a half. So you do get the reps in. So I would say getting a resident perspective and then getting a faculty perspective for me was really nice.
Great. What about you, May?
I would say that's really smart, Basil. I practiced with someone from Michigan. So they actually had a kind of like a free service where you could meet with someone that does this for a job and kind of practice and coaches you through it. So check out and see if your medical schools offer that. That might be something that you can kind of reach out to and see if you could get that service. And then I think Basil's point about you get better over time. I definitely was really nervous at first, and then it becomes really fun meeting new people. So it definitely gets better after the first few.
All right. Lastly, Irasema.
So for the interview practice, I practiced at my medical school with one of my attendings, and then Urology Unbound has a really awesome, like I think it's like a 2-day where you like it's like a mock interview where you send in your CV, your personal statement, and they offer you really great advice. So if you're a URIM in medicine, make sure that you check that out. That's a great resource. And then we had in-person interviews at Michigan, and you guys were kind enough feedback is there as well when I was a sub-I. So
nice. All right, Dr. Go, you're gonna have to watch our time because these can go hours. I'm sure there's a lot of questions in the audience. I want to thank our you know, our PGY ones, Irasema, May, and Basil. Now the questions I'm sure they're coming. So Claudia, you have your hand raised. What question do you have?
Hi everyone. Thank you for all the feedback and the insights. It's great. So my question is, how did you, because you all had so many interviews, how did you keep the stamina from like that first interview all the way to like the last interview? Make sure that you're delivering, you know, your best, truest, genuine self in each one of these without kind of, you know, going down.
Honestly, one thing I learned in med school is that coffee is delicious. So you get used to that kind of coffee in the morning. But the number two thing, I think you do get tired. It's like it is a marathon, which made it, I think, kind of more valuable to see where you really got excited from. There's some interviews you go to and you leave the day and you're like, wow, I felt like I just was hanging out with my friends. You kind of have that energy. And then there's other people that are like, wow, I was really working today, you know, maintaining the conversations and whatnot. For me, that was a metric that I really leaned into in terms of just how I felt, how comfortable it was, how much I felt like I was working to connect.
I think those are great points, Basil. They're definitely get to be very tiring at the end. I remember being at the end just thinking like I'm just ready to be done. But I kind of approach it like I approach sub-I season, right? Where you're just going in, like you're giving it your all for that whole month period. And so I think if you kind of like take that same mindset for interviews, you know, it's not quite a sub-I, it's a little bit different. You get to take breaks, you get to sit around in your pajama pants. But if you kind of bring that spirit of like, you know, this is like a month and a half, like I can get through this. That was kind of how I approached it, and I found that very helpful.
Yeah, I just echo what they both mentioned. You do lose some stamina, I think, towards the end of it. I remember after like when I was in the double digits of interviews, I was really, really like feeling like I was kind of dragging my feet, and I really had to like hype myself up to get through those questions. But kind of like Basil said, you'll know based on how you feel about a program on your day, kind of how you would fit into that program. It's a good metric, like you said.
Good. Priya, you have your hand raised. What is your question?
Hi, thank you so much, everyone, for all of your feedback. It's super helpful. I I was just wondering, what were your expectations going into interview season, and getting those invites? Did you expect to get that many? How did you know? How did you like basically gauge where you were and kind of what to expect?
Okay, so we'll have Basil and Iracema answer this ones. So we can get to as many questions as we can. So Basil, you go first.
Yeah, I think it is really terrifying because you have no idea. Like I remember thinking like, am I gonna get no interviews? Am I gonna get a lot? You really have no idea. I think kind of going in and try to being strategic with your like token placement. So kind of having a few that you designate as kind of reschools, a few that you feel more comfortable with, and then a good number that you feel like you are a good like fit for. At the end of the day, you can talk to current residents at certain places, kind of hear their experiences, kind of get a sense of what their CV looked like. I think it's easier to have those conversations with people that are a few years more advanced than you, than your own colleagues. So I'd recommend those people to be your mentors and then kind of get a feel of where you stand. But truthfully, I think you would get surprised. There's some programs that people imagine themselves like that's an easy interview and they don't get it. And there's some places that they never expected that they'd get an interview there and they do. So it really is kind of like hedging your bets. But I'd love to hear your experience
Yeah.
with that.
What's your perspective, Iracema?
Yeah, I completely agree. I think that I was really pleasantly surprised about how my interview, like invitation process went. And like full disclosure, I didn't have like the best step score. I didn't have a urology program, but I worked really hard on sub-Is. I really thought that my application shined in other ways that maybe, you know, yes, I had research experience. We all had volunteer experience, but you kind of have to highlight the things that make you you. And I really think that uncertainty of like, where do I stack up against people, that really never goes away. And I always tried to like gauge, you know, I would ask residents, like, do you think my, you know, XYZ is good enough? And you're constantly asking yourself this, but I just want you to know that everything will work out okay if you are kind and work hard and you are more than your score, you are more than the number of patients that you have. And just try to be yourself and highlight the things that make you you. I know people that matched who got 6 interviews, and I know people that got more interviews than I did and did not match. So it really is just, you don't really know, you know, it's hard.
Thank you. Thank you for sharing. I think Omar, you are next. What
And then
question?
Haley's got a question in the chat.
Yes, is it Healy? I see. How did you learn about programs, and ultimately, how do you decide how to do your away rotations? So, May, you'll take on this one. So, how do you learn about programs, and ultimately, how did you know where you did your away sub-I?
Yeah, it's a great question. For me, I really talked with mentors. I talked with the residents that I worked with in the past, as well as some faculty members. When I kind of narrowed down my programs, I said, you know, should I go here or go there? And I kind of got advice that way. I also looked at the program websites. And so I think that's another great way to look at it. They have a lot of information like you're going to do for your interview prep. You can look at like, how do they look at, you know, prioritize resident wellness? How do they do this? And so I think that's helpful.
Good. So, Omar, what's your question?
Thank you guys for your time. I'm not sure if this was already mentioned, but how long are interviews and what is the typical setup?
Okay. Basil, you want to take that one?
Yes, sir. They could range anywhere from a few hours, like maybe 3 hours was the minimum, to even a whole day. It really depends on the program. Generally, you're gonna log in a few minutes before it starts. You're gonna be dressed, gonna have good lighting, and there will be kind of a common room. Some programs will have maybe the chair or the program director say a few words. Some will just jump you straight into breakout rooms. So these breakout rooms could be anywhere between maybe 5 and 10 minutes long on average. And you'll be either with 1 or 2 faculty members or 1 or 2 residents, and you'll just be talking. And a lot of the times you'll not have much to say after a few, like before the time is over. So especially those 10-minute slots, maybe at like 6 minutes, 7 minutes, they ask you, do you have any questions for us? And then you could do that like just again and again, depending maybe on how big the program is, how many people they have involved in the interview day. So kind of be expecting maybe some places just a morning session, some places just an afternoon session, some places all day. And most of them will have a resident room sometime during that interview. So either it's a common room that you go to while waiting, or it's going to be like its own session where you could kind of have an off-the-record conversation with the residents about their experience.
And Basil, yes or no question. Did they cut you off? They tell you 10 minutes, at 10 minutes, they take you away?
Oh yeah. So not even just the faculty member, but just the way Zoom works. You see the time, and you're making a great point talking about how great you are, and Zoom ruins the party.
Yes, great. Thank you for sharing. Nancy, what's your question?
Yes, thank you. My question kind of transitioning to the one on screen, but about ranking. After interviews, how did you track sort of like the vibes and your impression, and if you thought it would be a good fit? Because I imagine, especially with all of the interviews that you all did, it blends together. So what are your, I guess, what was your process, and what are your tips on sort of keeping impressions straight to remember when it gets to the ranking process?
May, I'm gonna have you take that one. How do you remember how many you had? 17 or so interviews, and how do you rank?
Yeah, I think it's a great question. And it's tough, truly. I think you can talk to most of us, and most people, by the time they get to ranking, they don't quite remember unless you take really good notes. So that is my advice, is to really kind of take note. I think Basil said he did a great job kind of taking his impression, how he felt at the end of the day, and kind of writing that down. So I think that would probably be the best way to do it, is really kind of give yourself a good written impression, because otherwise you can't remember after you've done that many interviews.
Thank you. I don't see any hand risen, so I have one question for you guys, which in my mind, and I have a different perspective, and associate program director, I didn't introduce myself, but I work with students since 2019, and then in 2022 I joined, the education program. On the program director side of things, and I've been interviewing for the past 2 years virtually, and before that, it's 2 or 3. So questions for you. I think it's key to have a mentor. You don't have to name them, but I want to hear from the 3 of you. How many mentors you remember that were key during match season? I don't know. I'll have Basil, Iracema, and May.
Yeah, I love this question. I think you guys talked about it earlier, but there's different people in your life. Someone's a sponsor, someone's a mentor. There's different characterizations. I felt like when it came to choosing a program, it really came down to not maybe it came down to someone that knew me as a person who I really looked up to as like an individual. So I realized when I talked to some people, they'd be like, do this, my friend is there, or they produce a lot of research, which is, could be good advice. And then there's other people that maybe knew me, knew my family, and they'd ask questions like, what is your wife like? Are you okay leaving your family? And kind of more personal questions that you could have with someone that you really trust. So I would say, really identify the people that know you the most and who you look up to, and that you could see yourself being, like, for more than just being a urologist, whether it's like a parent, a community member, whatever it may be. For me, that was the greatest thing. So when I heard people talk about their experiences, how it changed them as an individual more than just as, a career, those are the people I trusted the most and felt like I got the best advice from.
Thank you. Iracema?
Thinking back to sub-I season and interview season, and I had 4 mentors. 3 were attendings. One of them was Dr. Romo. And then one was a resident who she's now going into her 4th year residency. And most of these people I had really long relationships with. They knew me very well, and I would go to them for different reasons. I think it's nice sometimes to get a perspective from someone who's gone through the process. So someone who's ahead of you. But kind of like what Basil said, you're going to have mentors for different reasons. And I think it's always nice to talk to someone who knows you for you, not just with.
Great. May?
Yeah, I think Basil's point about kind of the people that you kind of connect with most are super helpful. So I had a resident that I kind of connected with at each of my sub-Is from the different programs, and I would talk to them about it. Obviously not explicitly about my rank list, but, kind of guidance and general thoughts on programs. So I found residents to be really helpful. I talked to a few faculty, and then family and friends were really helpful for me as well.
Nice. I see more hands. Sam?
So it's kind of a more general question, but what's something you worried about a lot that didn't end up mattering, and something you didn't think about that ended up mattering more than you thought?
All right. May, I'm gonna have you take that.
Oh, that's a great question. I'm trying to take a minute to think about it. So something that I thought mattered a lot that didn't matter. I think I was, I guess, self-conscious about my research publications. And I felt like I had projects that I put a lot of work into that weren't necessarily to publication, and I was able to kind of express that through my interviews. And so I feel like that was like better than I thought it was going to go. So I guess that's my answer for your first question. And then what's something I didn't think was important that was important? I guess my hobbies section got talked about a ton. I kind of thought that was just like something I threw into my application just to be fun. And actually, I think every single interview, it was actually brought up and addressed. And I had it like buried in my application. So I guess people really fully read your application. So just kind of be prepared for that and include fun things if you want.
Great answer. I think those are perks. Hannah.
I was wondering if there were any questions that y'all really liked that you asked that you think we should ask, or if you, reflecting back now, can think of any questions of things that you wish you would have asked about.
All right, Basil.
One that I really leaned onto is you get asked, do you have any questions like all the time? One is like, what are you most proud of in terms of this program, and what are you most excited for? And generally, I felt like people had very authentic answers. When they talked about like really like strong relationships with the residents and they're excited about like this person graduating, whatever, I really felt it that they had that true love in them, which attracted me to those programs, especially.
Great. Those are great. That is great insight. I'm gonna put you guys on the spot. I know these three PGY ones very well. You know, as you guys may know or not, but last year we had what is it, 6 sub-Is from University of Michigan applying into urology. Everybody matched. We had a hard time. It's always very hard for a program to come up with a ranking list. When we have a lot of faculty involved, well, everybody has a score, and at the end, you know, you just do the average and you come up with a ranking list. Of course, there's more that goes into it that we cannot talk here, but you know, there's the people involved, the program director, the chair, and you know, you can imagine. At the end of the day, you can see we match one of our students. When you're looking at programs, you have to see, okay, how many students they're taking, where they're coming from. And so just to ask questions here is like, how did you get where you want to go, right? So if I start with Iracema, I can share with you that Iracema, I think, contacted me because I was in charge of the sub-I program a year before the sub-I or something along those lines. I didn't answer the first time. Maybe it was 2 or 3 emails. I don't recall. But then you get to answer, and it's like you see a student who's interested, and it's like, okay, DO program in Tucson, interested. We are in Michigan. Why are you interested in our program? So I'm just gonna put you on the spot, Iracema. Why did you look at our sub-I program, and why do you want to come in and to Michigan to do a sub-I?
Yeah, I think one of the things that I always looked at when choosing sub-Is was, okay, if I go here, who are going to be my mentors? And of course, Dr. Romo, he I have a lot of things in common with him, and I saw him as a potential mentor. I also saw that University of Michigan had a lot of female faculty. They're really great job of that. A lot of programs don't have, unfortunately, women on their faculty. I also looked at, like, when talking to people at AUA or at Western Section, what were the programs that really stood out that people were like, oh yeah, you want to do a sub-I there? They're known for XYZ. So I think reputation, talking to people, reaching out to the residents at the program, look that.
Yeah, that is great. And full disclosure, I didn't know Iracema at all. So it's after 2 to 3 emails that you see someone is interested. And like her, there's many others people that reach out, and sometimes there's connections. You will get an email from another faculty saying, hey, I have a medical student who's wonderful. It wasn't like that for Iracema. So if you don't have that mentor who's going to send an email to us, you don't have to have one. You just send an email, and if they don't reply, it's because we get a lot of emails every day. But people who are in charge of students, they will recognize, and they may be even better than me, and they'll reply right away. And when they say no, they just say no. So I would encourage you. And now, May, I'm going to put you on the spot. our sub-Is from University of Michigan do their sub-I experience very early. Some as early as February, some as late as June. I don't recall, May, when you did yours, but back in the day that we had our our formal interview during that time. So if you were doing a sub-I, let's just say in July, August, that's your time you're gonna have a formal interview, and then you don't get another interview in November when usually interviews occur. So May, can you talk about that? When was your sub-I with us, and how did you keep in touch with the program? Of course, you live here and you're in medical school here, but we didn't get to see you again. So how was it for you that you end up being staying with us? And I don't know, whatever you can share, whatever insight you have, because some of these guys may have an interview or a sub-I, and then they may not be brought back. Although the majority of programs will bring you back for a formal interview in November.
Yeah, Dr. Romo, that's a great question. And so actually my sub-I was in March. So I was on the earlier end. Yes. And I think it was a little tough because it was a long time before I ranked my list in January. That's almost a full year, right? And so I think you lose a lot of kind of that emotion. I was fortunate because I actually got to do a clinical rotation my M2 year. So I actually did 2 months with my home program, which was wonderful to kind of have that extra context as well. 2 of my programs actually did not have me back for an interview either. So neither your UNC or Vanderbilt had me back for an interview. So I kind of had a similar thing where it's like I went and rotated with these programs. I got to know them really well, but I actually didn't re-interview with 3 of my 4 programs. And I do think that made it a little bit tougher when I got to ranking season because it had been kind of a long time since I'd had contact with those programs. I stayed in touch with residents, so I think that was helpful from that standpoint. But with the program themselves, I didn't have like a formal interview process. And for me, kind of to your question of how I kind of came back around was I really sat down with my notes, which is again why I encourage great notes. I really sat down with my notes, thought about kind of the relationships, the faculty, kind of the feel of the program, kind of my relationship with residents themselves, and kind of where I wanted to be, and where I really saw myself for the next 5 years. And that's kind of how I came back around to my sub-I that I'd done a long time ago in March. And so for me, that was kind of my journey and process. I really, really loved all the places that I rotated, and I'm happy to talk offline about kind of different rotations and experiences there as well. So I kind of had a tough time, truthfully, when it came down to make my rank list. I think all of us probably had a really tough time when we were making those rank lists. Like you, I would love to say there's like a clear, absolute answer. But I think that there's pros and cons with every program, and I feel very strongly about that. And so you really kind of have to go through a process of working through that, talking with your mentors, talking with people you love. And that's kind of how I came to my decision, but it was a long time from my sub-I.
Great insight. I'm looking at the time and wonder if you guys have any questions. Otherwise, I have a huge list here. So Basil, you match at Henry Ford. What do you think? You only have to pick one. What do you think in your application, without counting your interview, help you the most? Do you think it's the personal statement? You think is the medical school? Do you think is the letter of recommendation? We're not going to talk about scores because, step 1 is a pass or fail, and I'm sure you did well on your step 2. So as programs, we're having a hard time now, reviewing everything. And programs like ours, not to, but I can only talk about our program. I was perplexed when I joined. We review every single application. We review everything, even when there were step 1 scores. Some people will filter. We all know that. And I'm sure there's maybe programs that will filter, but now with signaling, that has helped applicants because now programs are getting less applications. We used to get a lot more applications. Now all programs are getting less. So, it's very hard for a program to review everything. But now it's easier than before, or less difficult than before, less challenging, you want to put it like that. So Basil, pick one thing that you think was crucial for you to match where you wanted to match.
It's I'm gonna kind of answer the curveball. It was something that wasn't on my CV, but I think one of the most influential things was going to AUA my M3 year. Because at AUA, I really came in with the idea of like, let me just learn as much as possible and get to meet as many people as possible. So every second of every day, I was going to a different event, shaking hands with someone else, trying to just, enjoy it. And it was so much fun. You're with people that are so smart and everything. And it was at one of the events that I ran into the program director at Henry Ford, and we just started talking, and like I just realized how much we connected and loved him and whatnot, and sent a follow-up email, and we found a time for me to like spend a week at Henry Ford, even though I didn't, it was too late for an actual sub-I and I just had a week vacation. So I spent time with them, had the best time ever. Had a few other mentors that had connections there that like just told me how much they loved their time there, how they would be nothing without it and whatnot. And that's how I fell in love with it. And I think just spending that time with them, showing I was interested in and just, you know, having lunch with the residents and whatnot, I think they became comfortable with me. So I really think those soft skills, like going out of your way, meeting people, if you like have a connection with a resident, have a connection with a faculty member, always like say yes and like get to meet someone. Like the worst thing that could happen is you make a new friend. So I really enjoyed that process. And you know, I think just going into the deciding thing, I was so split. I remember my wife and I would have conversations every day, like, should we do something exciting and leave to the other side of the country? You know, should we, you know, stay close to home where like, you know, our family is? And these are really hard things. And there's all these things that go through your mind, like what would my friends think? What would my family think? All of these things. Sometimes like it's natural to look at rankings and whatnot. All of these things kind of go through your mind. So I think it's really important to prioritize like what really is like important for me. Where will I be happy? Where will I be able to accomplish my goals and kind of succeed in every aspect of my life? So again, all those factors are important. I think it's just important to really focus on really the ones that will result in like extended happiness.
Man, thank you so much for that insight. I have to echo what you just said, and kudos for doing it. We also, as a program, we offer a sub-I after, you know, application is submitted. So as you all know, the hot months are July, August. Everybody wants to do a sub-I in July and August when it comes down to an away sub-I. But why is that? Well, because September 15th, the 20th, something along those lines, there'll be application deadline. It used to be September 1st. Now it's no longer September 1st. So it's, you know, it's the second week of September or something along those lines. So even if you do a sub-I in September, it's very well received by the program because we know you are interested in our program rather than just getting a letter that is, you know, that is going just to give you a letter of support. Okay, is so and so, met him, know him. You know, sometimes you need that. You need the blessing. You need people to vouch for you, and that's why sub-Is are there. But number one reason is for you to learn urology, to expose yourself, and to get those letters. We have one in November. I'm sorry, in October, just before interview season, and it's also very it's, you know, a lot of people are interested in that one, even though they cannot use it to get a letter of recommendation for their application. So I would encourage you, all you guys, reach out to programs to say, hey, I'm interested. I have a week, I have a 2-week, or is there any way I can visit your program, even though, you know, application for sub-I season is over. And of course, you have to have the blessing of your medical school and work things around so that you do it in a proper manner. What time is it now? 3:15. We got 5 minutes. I don't know. Any last comments? I don't want you guys to put you on the spot, but any last comments? Any of you three, any last piece of advice I didn't think about?
I'll add one, just because it was kind of something I realized. I think as like students in the United States, there's a lot of household name hospitals and medical schools people are familiar with. Just remember that urology is kind of always a separate entity. So you might have a hospital that's very well known, and then I'd go interview there. I'd be like, wow, they have less resources or support or things kind of their ducks in a row are different than maybe a hospital that maybe less people know about that's a regional hospital. So I think always kind of look at the urology department as its own unique set rather than as part of this, you know, household name that, you know, people might think is a shiny object from the outside, if that makes any sense.
Good. Mayor Asema, last minute comment.
I guess my last comment is to really kind of lean into what makes your application unique, and that will shine through in your interviews as well.
Yeah, similar to that, I think more than, you know, research, more than anything else on my application, I think the thing that I talked the most about during my interviews was my story and how I was able to connect with, you know, so many people across different life experiences. And if you have a unique aspect of your story, make sure that you highlight that, lean into it, own it. But on the other side, if it's something you're not comfortable talking about, I would avoid mentioning it. Just some advice.
Well, this is great. I want to thank you, you know, for sharing. These, you know, these guys shared a lot, and it's very personal. This is a journey, and it doesn't stop here, as you all know. We're all on it. I want to thank you for your attention, and I wanted to share. I don't have it here. My PowerPoint is no longer, but like Iracema, I think, and all of you guys said, you guys got this. It's just a matter of time. For some of us, I'm a foreign medical grad. I didn't match the first time. I had to do research. So everybody has a journey. If you want to be a urologist, and you have the fortune, the luck, the support, the family, call it whatever you want. But if you really want it and you have that extra, which is support and something that cannot be named, it will happen. And you just have to knock doors every day, and one day one will open, and it will just happen. So I want to thank you, our soon-to-be PGY1s. And yeah, we finished 2 minutes early. And I don't know who's next. Dr. Go.
In medical school leading up to my urology residency. And so I came into medical school sort of assuming, like many people do, that I was going to do internal medicine, maybe cardiology. Fortunately, I mean, everybody that does those are great, but fortunately I did those rotations early, and I found out it just wasn't for me. I actually had my surgery rotation at the end of my third year. And it was definitely like a light bulb went off in the terms of the days just flying by as I was in the operating room with the general surgeons and then with the other surgical services. But I certainly gravitated towards urology, which I had at the very end of my surgical block. I became attracted to it for many of the similar reasons that you guys might be, the mix of medicine and surgery, the technology, and the personalities. And so at that point, it was early June, so like nowish back then. And I felt a little bit behind as far as getting prepared. I had been involved in other sorts of research throughout medical school, but nothing urology specific. So I think the big thing that I did was I just tried to communicate with as many potential mentors as possible, starting with the chief residents at that location at Vanderbilt at the time. They really helped point me in the right direction and help me identify which attending mentors would be the most helpful, have the most insight in terms of how to move forward, and also, which ones make projects that could lead to bolstering my application and just kind of getting my feet wet in the world of urology. So I remember that very vividly, and I definitely considered, do I need to take a year off or not, but to do some research or not, since I decided so late. But I decided to take the plunge, and I think that was just due to encouragement from a number of mentors that I just met and old mentors as well. And so, I spent that summer getting involved in some work. We did produce some abstracts, and then I just went directly into my sub-I season. As you go through the sub-I season and interview season, you will continue to pick up additional mentors. So I think it's important to realize there are many people that can feed into your future career. One of the things that I think I didn't necessarily realize was that people in academics, like where you're training, in part they signed up for that because they like mentoring medical students. I always felt that it might have been a little bit of a drag, or that I could be bothering them. But now that I'm on the other side of it, I can see why it's one of the more fulfilling aspects of being involved in the training of medical students and residents. So I think really shouldn't be shy about reaching out to mentors. Of course, you have to identify those that are really enthusiastic, but I think you'll find that most people most likely are, or at least enthusiastic to point you in the right direction. And then, I definitely communicated with my mentors a lot as I was trying to narrow down which residency program I'd go to. Fortunately, at Vanderbilt, there were a couple of people that were really well acquainted with UCLA, and they just sort of put my mind at ease about, the concerns of going across the country and what it would be like to work there. And I really set me up to be excited for what I thought was ended up being great training. And yeah, I mean, that's pretty much my journey into urology. You guys can definitely let me know if you have any questions or if anything came up that you want clarification on.
What was the best piece of advice you got?
The best piece of advice that I got going through. That's I'm not sure if I have a great answer for that. I think more than advice, it was encouragement, validation that I got along the way. I think I was somewhat hesitant going into it after deciding so late. And so I think having the advice of people that have shepherded other people through the application process and, are actively evaluating applications, getting their input on what my application would look like and such, I thought was the most helpful more than anything else. Yeah.
And I think we have Dr. Washington on now. If you want to, hopefully your laptop's cooperating. I certainly know the feeling.
Yeah, there's always something. But hi everyone, I'm Samuel Washington. So I'm a urologic oncologist, assistant professor in urology epibiostats at UCSF. Nice to meet everybody. Sorry I'm late. Technical difficulties. Perfect. Should I just go through my whole process of how I got to where I am? Excellent. So for me, I guess I was one of those people who was exposed at an early age to medicine. So no one in my family was in medicine, but we had a family friend who was a cardiothoracic surgeon. So he tried to recruit me early. So at the age of 7, he told me what he did, and I thought it sounded cool. So that was kind of the party line through medical school. It wasn't until I met Kirsten Green, who's now chair at University of Virginia, and then Peter Carroll, who's been our chair at UCSF, through interesting small group discussions in medical school about erectile dysfunction and pediatric GU malformations, which seems just like a crazy combination of lectures. But through those, I could tell that personality-wise, it fit better with urology than with cardiothoracic surgery. And that was really the thing that helped me explore and kind of question what I wanted to do and why. So I was able to really get a lot of mentorship from Dr. Carroll and Dr. Green that led to a year off of research at UCSF over the summer, which is quite common for us there. So there, that helped me kind of figure out, okay, do I want to do academics or do I want to do just private practice? Do I want to do urology or something else? So definitely got big gulps of the cool urology through that year, and got a lot of tastes of learning statistics, learning epidemiology, learning clinical research in a very standardized, structured way under Dr. Carroll and Dr. Green. So those are the things that really helped me decide in that year what I wanted to do and helped me figure out life questions and choices and things like that. After that, thankfully, I was lucky enough to stay at UCSF for residency. So I had kind of continued mentorship, and that helped me kind of figure out, okay, within academics, what am I most interested in? What area? I'd always been interested in cancer. I was a genetics major in college, so the kind of the cancer genomic aspect of that was always interesting, but I never wanted to be in the lab. Sorry to anyone doing basic science research, but it just wasn't for me. But the questions behind cancer were always interesting, and that's what drew me to urologic oncology. Again, personality-wise, things seemed to fit. I had other mentors who were fellows and residents who are now faculty at UCSF and other institutions. So slowly building that support structure, all under the guidance of kind of seasoned, I call them gray hairs when they're not around, older, more senior urologists who help kind of guide me big picture in what I should be thinking about. They helped me understand kind of what questions I was interested in. I was interested in cancer, but not so much the bench side, but how is care impacted based on where you live, who you are, where you come from. Having grown up in Texas and then a transplant in California, there was a definite culture shock that happened. So when I got to California, it helped really raise questions of just my own lived experience of how care is going to change from San Francisco to outside Houston, where I grew up. And that's what really helped drive me in terms of the questions I hope to answer later. And then it wasn't until the locker room, fourth year of residency, where I was talking to the onc fellow who said, you know, if you're interested, you should just do it. And that was kind of the umph that I needed. So during residency, I was lucky enough to be accepted into a program focused on epi and biostats, specifically for clinicians interested in this type of work. So I was able to take structured coursework during my research year of residency, focused on these skills and how to ask these questions. Mentors helped guide me through the process of every step of applications, of what to do, how to prepare, what programs I should think about. And then they were really kind of the rock and the sponsor for a lot of other opportunities that came along the way. So thankfully, I was able to stay for fellowship at UCSF. You're starting to notice the pattern. But it was a great environment that let me grow, and that allowed me time to finish a master's in epi and biostatistics. Again, focusing in this area of how do we understand what may change based on where you live, where you get your care. That's what led me to other mentors now outside of urology, but within the UCSF environment. And they really brought in, okay, these are now epidemiologists who are doing disparities work, biostatisticians doing different types of modeling that I had never heard of prior to that. And that's what thankfully allowed me to then proceed with a master's in epi and biostats, and mentors now outside of urology, but all focused on the same problems and the same questions. So it was really the building of this network of sponsors and mentors and support that helped me get through every step of urology. Now that question has really been, okay, how do you change organizations in which you see these differences, or how do you change healthcare systems? So that's been the other aspect of growth that's happened over the last year and a half, 2 years, and change in kind of my research. So it's been a fluid process, always anchored on that research interest, and then finding environments and questions and groups of people that kind of match my interests, my personality, and goals. And that's been kind of the most fruitful or beneficial part of this whole process for me. That's helped guide me through urology, which has so many different possibilities. You can kind of think of anything and there's probably a route for you to get there. It's just really finding people that will support you and sponsor you through that process, if that makes sense. Great. I guess any questions?
Hi, everyone. I'm back. Dr. Washington, thank you for sharing. And yes, please, folks, you know, like throughout the rest of the sessions, don't hesitate. Use, if you want to throw it out to the group and we can read it out, you know, use the chat feature, but also in between the pauses of these speakers, you know, feel free to take advantage of that time, either unmute yourself and speak up or use the hand raise feature, whatever you feel most comfortable with.
I have a question for Dr. Washington. My name's Shannon, by the way. I'm rising fourth year at UCLA. It seems like you're very attuned to research being at the core of what you're interested in from an early age. And I think as we're all coming into the stage of applying and making this narrative of what's at our core. I wonder if you have any tools or recommendations for how did you reflect along your journey and kind of coming to this conclusion and like realizing, okay, how do I stay true to that? Because I feel like as students, we have so many opportunities. I'm sure as residents, we will also have many opportunities afforded to us in this system, and it's easy to kind of get caught up in lots of things, right? So do you have any recommendations for kind of in this process reflecting and then continuously along our careers as well?
Yeah, I have, let me say, my thoughts are my own, so I don't get anyone else in trouble. But I thought of it in kind of a few different ways. There was always an interest in doing research. So the first step was, okay, where do I have an environment where I can learn the skills to do it independently? And that was one aspect. So it was great that I had an environment where I could learn. There's data that I could use. And it was after that point, and then I had the mentorship, the support group to help guide me through those steps in a structured way. It was after that that once I was comfortable with, okay, this is what research looks like. This is what a research question is. This is how to understand the papers coming out and the methods. Then I started to ask, okay, well, for what I want to do, documenting a lot, saying these things should happen. And that's where my questions started to evolve. It was not so much, how can we optimize dominant tumor notification in prostate cancer, which was one of my first projects in the department, but how do I figure out how to get better biopsies outside of UCSF? What does care look like 2 miles away at the county hospital versus UCSF? And you start to see, once you have the skills, then you're like, okay, I can ask different questions. And then after that, it's like, okay, well, how do I appropriately ask these questions in a way that makes sense and is not just the same thing being repeated over and over? So it's that kind of process. Think of it almost stepwise. Part of it's, for lack of a better term, transactional. You're thinking just, where am I going to learn the skills I need? Where are the resources to help me grow? And then the other part is, okay, once I have these skills, what do I do with them? And as you evolve through that process, your questions and how you think about things will change. And that's why I say it's very much fluid, but you're always thinking forward, if that makes sense.
What if you're not a great speaker, you're just an introvert and you really don't want to present anything? How do you overcome that fear?
Well, I am very much introverted, and I do not like talking in large groups. But it is just a skill that can be learned. I feel like a lot of my friends, colleagues are very much extroverted, very much outward-facing people that like to discuss on social media or presentations or any of these things. I do not like doing any of that stuff. I'd rather be gardening and doing statistics and playing with my kids. But what I've learned over the last, I was in the department in 2010, so the last 14 years, is that it's truly a skill. And over time, you'll develop that skill. Everyone else has their process. I think about like any given Sunday, it was very disgusting, but that guy would always throw up right before a game. And then he'd go and crush the game. And don't do that. But everyone has their obvious process of what they need to do to feel more comfortable. And I think one thing that people always forget when they're giving a talk is you're now the content expert. So you have to internalize that a little bit more and realize the thing you're talking about is something that people asked you to talk about. And hopefully that helps with some of the anxiety. Practice and just internalizing that a little bit helped me. If that makes sense.
Smith, do you have any of your own pearls for presentations?
That's a good question. For just stage, feeling comfortable speaking publicly, I think that's something I still struggle with to some degree. But I think owning the content and practicing prior makes it a lot easier.
I just have terrible imposter syndrome. When you think I'm the expert on what I'm talking about, that's like a serious, like, what are you thinking in the back of my head?
I have a
Go ahead.
So both Dr. Smith and Dr. Washington, you both project confidence and project a lot of security in what you're saying, and I think it's very admirable. At times where you felt, and this is kind of about imposter syndrome, at times where you felt like maybe you're in a room full of people and you either don't feel like you fit or that you belong, what are some things that have helped you cope, that to today bring you to present yourself with so much confidence?
You can go ahead, Sam, if you want to start that one.
Oh, geez. I wouldn't say, I think it's not so much confidence that was built up over time, but a fear of being embarrassed, ostracized, all those things were always the things causing anxiety for me in the back. And then over time, especially as I started to think about the questions I'm asking, the data I'm presenting, the way I'm doing it, that's where there was less fear of embarrassment. So now if I present research or something I'm talking about, it's not so much confidence. It's like, I'm not sure if someone were to challenge what I would say, do I have a response to that? Does that kind of make sense? So I'm not so much worried I will be unable to answer questions, but is this a new way to think about something I didn't? Is this an opportunity to dive into another area? So once you change how you think about questions or things like that, it becomes more an opportunity, especially if you're at a conference where you have leaders across so many different subspecialties of urology. You're getting like free knowledge, free advice from some of these questions. And when I started to think about it that way, I was like, oh, okay, this will be interesting.
Yeah, that's such a good point. That's exactly what Chad would tell me when we were presenting some of our work at the North Central section of the AUA. He was like, presenting these posters or podiums, some of the questions, and actually some of the tough questions, are the best things to get in kind of that live feedback setting, because that's something that a reviewer would probably bring up, when you submit a manuscript. And so you've actually already thought about it. And in many ways, you can incorporate into your manuscript how you're kind of mitigating that concern or that deficiency or that weakness, regardless of what type of research is being presented. That's such a good point. Coming back to the public speaking, I mean, it is a skill set. So like with any skill set, it really just comes with practice, repetition, practice. Chad didn't get to this in his like M1, M2 session this morning, but some of the first presentations that I ever did, he was like, bring a script and you will know exactly what you're saying for every single slide, and you will have timed it. So you'll know exactly how much time it takes. And he was like, for the first couple ones that you do, it's totally fine if you're actually reading off of your sheet of paper per slide, because if you stay on time and deliver the material well, that's already a win. And then over time, you start to, internalize that you don't need the sheet of paper. You use the little notes at the bottom of the PowerPoint. And then over time, when you become a content expert like Dr. Washington, you don't even need those notes. You have the 3 bullet points on a slide, but you can talk about it and talk, through it without needing some more cues. So it really is something that over the course of primarily residency, some people get a good exposure in medical school, but primarily residency, fellowship, et cetera, it really is a skill set that you continue to develop.
What are some of your thoughts about encouraging mentees, like especially those who don't love to write? You've done the presentation, but now the paper is like stuck in limbo, and they don't love writing. Like, what is your way of encouraging them or setting up a roadmap for success when they do that?
I'll let Dr. Smith go first on this one.
Okay, well, yeah. I mean, let me preface this and being totally clear, I think for me, while I had an interest in research for most of my training, I don't think that in the end it was really the thing that got me out of bed in the morning. It's not where I found most of my excitement. And so I definitely engaged in research because I enjoyed learning. I enjoyed interacting with people that way. And to be, honest, it's the currency in the academic world. And so, but I guess I could say that, so those things motivated me. I think I specifically sought out a position where I could be involved in the things that I enjoyed the most, like teaching surgery and taking care of patients, working with residents and medical students, but still not having my feet held to the fire as far as like research production. So I'd just like to let people know, even if you think that research is not your thing, I think there's definitely a place in academic medicine for you.
And I think for me, I have to find something exciting about it. So I think when it comes to trainees or someone that I'm mentoring and writing, we have to figure out like a question that's interesting to them. Because I feel otherwise it just feels like an essay you're writing in college or high school, where you're just forced, and that comes across when you're writing as well. The other part is being realistic. It's just a skill that you have to learn. And it's just one of those things where it's an aspect of academics that is part of the currency. It's one of the metrics, depending on which route you take. And that's really the aspect of it that you have to kind of think about is which route you want to take. If you're interested in doing research and publications as one of the metrics, then making sure that you are comfortable with that process. And it is a process. It is just the same as writing any other personal statement, any other letter to the editor, anything else. There's a format and a structure to it. And you just have to get your reps in and get used to that format and that structure. It also helps you kind of frame and organize your thoughts in a way maybe you didn't think about it that way before. Because now you really have to explain what you did, what you found, and why it's relevant. You can see how that's something that you have to do in any different other venue as well.
Switching gears a little bit, when you see these young folks come into your OR and your faculty, what are some of the things that are expectations for them? Like you would expect them to know this about your patient, about the case.
I can answer that. I think it depends on the level, for sure, like which what year of medical school you're in. I think, if you're a first year and second year, I'm mostly just excited that you're there. You're getting your feet wet, you're interested. You'd want to see what this is about. And so I'm excited to show you around. I think as you approach you're more in third year and you're trying to approach this more like a job and auditioning for a job, and especially as a sub-I, I think, the obvious things to be prepared with are who is the patient, what's their overall history and why are they here, and what's our goal for them today. And I think I don't necessarily expect any of the medical students to really fully understand all of the steps of the surgery that I'm going to do, especially if it's the first few times they've seen it. But it's just you look for that interest in understanding who the patient is and why we're doing this today. That I think engages us with them. It makes it easier to engage with them.
I think for me, especially in the OR, anatomy is just the thing. Not that you need to know every minute nerve and all of these things, but understanding large structures in the pelvis. Say if we're doing a prostatectomy, knowing where the prostate is, generally speaking, ballpark is great. Or like when it clicks and you see that, this is where the bladder is relative to the prostate, relative to the lymph nodes in the operator. Like, okay, that makes sense. That's exciting. So I feel like if you just remember why you're doing any of this, it almost fills in a lot of the blanks, right? It's like, why are you in the operating room? Well, to learn why we do the surgery, how we do it, the anatomy that's relevant for it. So it's not so much that you have to overperform compared to the residents, but just being engaged and like interested in what's happening, I think is the biggest thing. I don't think any of us really pimp the way we used to. So I think like coming in and just having questions or being interested is the bar.
But that is a really good question, Dr. Go, and especially because we have some folks who are M1s and M2s. The thing that can happen in a lot of medical school is like, your schedule's kind of unpredictable or changes last minute, right? And all of a sudden you get thrown in and they say, we changed the schedule last night, go to this OR instead. First impressions are really impactful in anything that we do in life. But I would say take a second. It's better to be 5 minutes late to an OR and take a moment on the computer and look up who is the patient, what surgery they're having, what they're having it for, and at least have that little bit of knowledge, which is usually just the 1 or 2 clinic notes prior to that surgery. That if you just review that, you'll have some of that context. Because there's nothing like walking in and somebody asks, a student or resident, hopefully never happens, but certainly even students walking and saying, so what surgery are we doing today? That's going to rub the attending surgeon the wrong way. Because it's like, wait, this person's coming to the OR. A person's like life and health is involved, and they didn't take a few moments to do that extra amount of research. So even with the last minute shuffles, let's be honest, no one knows who's assigned to their OR, or if a student is coming, so no one is expecting you necessarily, unless you're like the sub-I and was rounding with the team that morning. So taking those extra few minutes to just doing that little bit of like review, research, have context for what you're walking into can be really helpful. We have a few more minutes before the next session, which is one I'm really excited about because it's really talking about the many different programs that exist across urology, looking at different underrepresented groups within medicine in general and within urology. I know some of our speakers are already logged on, so I'll give it a couple more minutes, but if folks don't have any additional questions, I think it's okay to transition to that a few minutes early. What do you think, Dr. Go?
I think that should be fine. I just have one curiosity question because one of the folks, we had an in-person session a couple days ago, and they basically said, Google the person you're going in the OR with, especially when you're on your sub-I, know about the research so you can make them talk about it. Has that happened to you?
Dr. Washington, I'm going to call on you because I see you smiling.
Oh, geez. So I've seen it happen 2 ways. So it is, I guess, happened to me at this point where people have mentioned something I'm rambling at or something related to research. I've also seen it where students have lectured my chair on prostate cancer when he is like one of the world renowned people in that space. So don't be on that side of the spectrum, right? Definitely know who is in the room and kind of what their content area of interest may be. Just so you're not lecturing someone who wrote chapters on it, right? Yeah.
The textbook on it.
There we go. Is it okay if I share slides?
Please.
Yes.
It should automatically let you, but if not, I'll click
Cool.
around then.
Sec. It's like, oh, new laptop. Okay, there we go. Perfect. Can everyone see here?
Mm-hmm. All good.
Excellent. So the UReTER program, I think all of us have some idea of what the workforce within urology looks like. We've seen over time that the demographics of the workforce are changing for the better, but in some ways it's staying the same. And we've seen slow improvements over time. And with a lot of, let's say, current events and things happening, there's questions of how that will continue to change over the next 5 or 10 years as a large portion of the workforce retires and new applicants, hopefully everyone involved here and participating here, gets recruited into urology to see how the face of urology really changes. But we know when we are talking about students who are interested in urology or in medicine or different things, the impact can really be significant when it comes to some of the hurdles that people have to face getting into urology or other programs, whether it be the perception of the matching process, whether it's the distribution by gender of the workforce, or that circle of urologists or people within urology that they may be exposed to, and really perceptions of what is happening within the field. And that is really what led to the creation of the UReTER program. Part of that was just a response to what was happening at the time in 2020, 2021. And this was really something created and led and bred from the residents. So I do not claim any ownership over this program, and we're proud of that at UCSF, and the fact that this is something that was created by Dr. Zhang, and Dr. Love now leads, that is supported by the department to create an environment where trainees, medical students, residents, fellows have an opportunity to actually talk to other people within that space, people who are near peer mentors, so maybe a year ahead or 2 years ahead, to really get that guidance and that opportunity to ask questions, have reviews, have another set of eyes on any aspect of this, in a safe space, a safe environment with people that have a similar interest and potentially a similar lived experience that they have. And that's really been the goal of the UReTER program. And now it's in its 3rd year. So over the last 3 years, there's been over 100 mentees, over 200 mentors from multiple different residency programs, fellowship programs across the United States. Looking back, we now have enough participants to really understand what's happening with UReTER and how we can make it better. You know, people were really looking for opportunities for an established mentor. And oftentimes that power gap, for lack of a better word, from a student to an attending can leave a lot of space for unanswered questions, areas where people may not feel comfortable asking and attending about where they should apply, what they should do for their personal statement. Also, attendings may be a little bit too far removed from that process to give kind of updated contemporary insight into what's happening. And it's an opportunity for formal structured mentorship that people may not be able to get depending on, again, where they're training, what their faculty are doing, whether they have residents, all sorts of things that are hard to adjust for or measure, even with the census data we have now. And that was really an interesting thing, is when we started to look at who's getting involved with UReTER, you see it's people from all over the country. And that's the great thing. You're not limited to a small bubble within your institution or within your state or even within your section of the AUA. Now you have opportunities to really get involved, talk to people who may be on the other edge of the country from you, and get an idea of what a program may be like on the other coast or in the middle or even in your own state. Opportunities to just have conversations you may not have had thus far. And we're proud of the fact that we are engaging a lot of students who may not otherwise have had opportunities to get some of this mentorship, filling in that gap that thankfully UReTER is one of many programs now that is starting to fill in that gap and help with that secondary curriculum, let me call it that, of navigating this process of getting into urology and staying in urology, which is just as important. And thankfully, UReTER has now become part of the pipeline for UCSF for us really to understand what's going on. Let me stop there before I start talking about our other programs within UCSF. But hopefully that makes sense for you guys.
I just shared the link to the UCSF UReTER program as well through the chat, and we're going to have some additional deliverables and compile all the resources that are being shared as part of this conference, and it'll be sent out to all of you via email once the Michigan Urologic Academy is over. But if you want to start taking a look, the link is there. Wonderful. Dr. Wilson, would you like to go next? And then we'll take it again, as per usual. Feel free to shoot questions through the chat or reserve them to the end before the concluding remarks.
Yes, definitely. Can you guys hear me well?
Can hear you perfectly.
All right, perfect. I'm going to be putting some links into the chat myself. So, hello, everybody. I'm sorry I can't be on the screen. I'm not feeling very well. We'll keep this brief, but my name is Dr. Chanel Wilson. And I'm the founder of Urology Unbound. And, similar to what Dr. Washington was just saying, Urology Unbound is an organization that was founded kind of out of just recognizing the gaps that it existed and within our urologic education that really just wasn't serving the pipeline to increase diversity in urology into the urology workforce. So at its core, Urology Unbound is dedicated to the recruitment, retention, and promotion of underrepresented urologists. And so we work with folks who are racially and ethnically underrepresented in medicine, Black, Latinx, excuse me, Alaska Native, Native American, and excuse me, and also Pacific Islanders. But we, at our heart, we started as a group that was working with primarily with medical students, though we've branched out and are continuing to work with residents and professionals as well. But we're all here to speak about the medical school student component. And so one of the things that we're most known for is just our quarterly webinars where we get on with you all and really just try to answer those questions that folks have that they don't really get from their institution. We want to unmask the excuse me, the hidden pipeline. And so we always tell everybody that, there's no dumb questions here. There's no wrong questions here. We'd rather you ask your questions with us. And so that we can give you that guidance and mentorship. We also do a lot of applicant program. And although this year we're going to be doing it differently for our applicants, but in general, we do application review through our application polishing program. We also do a lot of mock interview and interview practice with folks. And ultimately, we're always here as a resource to be able to connect folks to our network, because that was ultimately what we wanted to do. We wanted to make sure that our networks were available to you all because urology is such a small specialty. It really does matter who you know. And we know a lot of folks who can be in positions to be able to get you the resources that you need. So when folks need help getting research projects, a lot of times you're at schools where there's not that opportunity. We ask folks to reach out to us, and then we work to connect you to potential research mentors. When folks want to have questions about, how to study for or prepare for the urology sub-Is, we always have a webinar every year that's dedicated to that. And we have all of those videos also archived. Dr. Andino is showing our website, and that's one of the links that I shared in the description. But all of our members have access to the website, and then they're able to then go on, get access to our archived videos, all of the different resources we've compiled over these last 4 years. And ultimately, we always ask to hear back from our members to find out how we can help and what other resources we can provide. So, that's just a general overview of Urology Unbound. In the description, I posted a link to the volunteer jot form that we have going out that's for residents and attendings in urology. So if any of you know any urologists who say that they want to be able to mentor folks and help them, especially during this application season, we encourage you to send them out. The way we're going to be working this year is all of our student members are on a GroupMe that we share, we have conversations on and we share resources through, and we'll be posting a link with our volunteers who are able to do the application review and also to do one-on-one interviews with you all this season. We're going to continue to, of course, have our webinars, and we'll always be here as a resource for everybody, and are very hopeful that next year we can come back stronger than ever with our regularly scheduled programming. We're very lucky that our wonderful Urology Unbound intern, Nana Frimpong, is there at the Michigan Urological Academy this in person. So if any of you have questions, please reach out to him. He's been one of the main reasons that we've been able to keep things going in the last year, and will be staying on with us this upcoming year. So definitely reach out to him and reach out to us. That email that I provided is the one we use specifically for the interest group, so that we don't get we make sure not to get any messages lost. So happy to take any questions, and I wish you all the best.
Thank you, Dr. Wilson, for being here with us today, despite not feeling well and sharing all that information. Any questions from the group? I'll say I've personally been able to participate in some of the webinars and some of the interview prep and CV prep, and it really is a fantastic resource. There's nothing like getting a chance to have, kind of an outside set of eyes and people who've been through the process give you feedback and help you get prepared so that when you're doing those first interviews in the fall, it doesn't all feel brand new.
I see Dr. McIntyre. Did you want to do the presentation?
Yeah, sure, I can do it. Can you hear me?
Yep.
Can hear you and see you.
Okay, good.
Slides up.
Okay, thank you so much. Sorry guys, we had a prostate cancer screening in Chicago, and the getting to the airport is hard.
One second. Can I have an? Okay, where's that screen? Okay.
Awesome.
Oh,
it's visible.
Yep.
Okay, do you guys see it?
Yep.
Presentation mode. Okay.
Hi,
There it is.
everybody. My name is Linda McIntyre. I'm the immediate past president of R. Frank Jones. And as you can see on the first screen, there's our website, blackurologistsociety.org. Next slide.
There we go. Now, trying to get it to cooperate. Why is it not? Oh, now it
Okay.
wants. Sorry about that.
That's okay.
Go back one.
Okay, so basically, the National Medical Society was formed because the American Medical Association at that time did not allow Black doctors admittance. And so out of that was formed the National Medical Association in 1897. And every specialty of medicine is represented in the National Medical Association. And that's how R. Frank Jones was actually started, as the urology section of the National Medical Association. Next slide. Dr. R. Frank Jones was one of the founding members of the urology section of the National Medical Association. Dr. R. Frank Jones is the first African American that was board certified in the American Board of Urology. One of the most important things that he did was he started a residency at Freedman's Hospital, which is now Howard University, in order to have a residency where men of African descent could be trained in urology. The other important thing about his program is that the fellowship at Freedman's Hospital allowed African Americans to complete the fellowship in anticipation of board certification. Dr. Jones applied for membership in the AUA in 1937. He was granted membership, and it was then rescinded, stating that he didn't have the proper references. Dr. Jones waited till 1965, 28 years later, when the American Urologic Association formed a member at large, when he was then granted admittance. From that time, he had become clinical professor and then chair of the urology program at Freedman's Hospital. In 1977, when 1979, when Dr. Jones died, the name of the urology section of the NMA was changed to the R. Frank Jones Urological Society. Next slide. So this slide just talks about our changing nation. And as you look at the demographics from the US Census.gov, you can see that why diversity, equity, and inclusion is important for race concordant and culturally competent care. We need more diverse physicians to add to the intellectual pool of medical scientists. In 2060, it will be predicted that 18% of the US population will be Black. Next slide. However, the latest census information we have access to shows that the number of African Americans in urology has been pretty stagnant for the last decade. It's been wavering between 2.2, 2.4%. Next slide. So our vision at R. Frank Jones is to increase the number of Black and ethnically diverse urologists, to provide a supportive community that fosters their personal and career development of urologic surgeons, to promote research and clinical care of Black patients with urologic disease, and most importantly, we strive to significantly reduce healthcare disparities in Black patients with urologic disease. Next slide. We participate in 2 conferences, and we serve as the urology section of the National Medical Society. I just want to mention that our annual convention for the NMA, we just had the AUA in San Antonio, but the NMA is August 3rd through 7th, 2024 in fabulous New York City. Next slide. One of the things that R. Frank Jones does at the NMA, which will be coming up in August, is that we have the William Baker Residence Research Forum. As you can see the picture there, and that was from last year in New Orleans. As the medical students, residents, and fellows can present their research in a forum, trainees are reimbursed for travel, monetary awards are given as prizes, and it's an excellent opportunity for students to give an oral podium experience at a scientific meeting. So if you follow us on Instagram or on our website when the announcement comes out, which probably will be next week, make sure that if you have a research project to apply, 2 nights hotel, airfare reimbursed, and monetary prizes will be given. In addition, you'll have the opportunity to kind of hone your abstract or your presentation because it is kind of a vigorous process. Most members of R. Frank Jones have participated in the research forum, and it's an excellent opportunity for national attention and to buff up your residency application and CV. Next slide. Connections are made at the R. Frank Jones Mentorship Reception held at both the AUA and the NMA. So we just had a reception at the AUA for residents and medical students where we give a presentation, and students are given the opportunity to meet other African Americans in the field of urology. And we'll be doing the same in New York at the NMA. Next slide. So these are a few pictures from the presentation, from the mentorship reception in San Antonio. And the gentleman with the blue tie, blue jacket is Robert Waterhouse, who's the current president of R. Frank Jones. The young lady, Ashley Appleton, is the medical student representative for R. Frank Jones to the AUA Medical Student Committee. So it pays to be involved. In the third slide, you can see we have our youngest R. Frank Jones members. We take them very young in our attempt to make more Black urologists. Next slide. And that's Brian McNeil from SUNY Downstate. So the other most important thing that we do, and the first one we did was last year. In the past, R. Frank Jones would do prostate cancer screening at the NMA conference for NMA attendance. But currently, our goal is to decrease healthcare disparities for Black men in the community. And so last year in New Orleans, we were able to do prostate cancer screening. We partnered with with Tulane University, and we were able to screen 109 Black men for prostate cancer. We were also able to give out free haircuts, lunch, and we also gave COVID vaccinations. Next slide. I think Chantal just told me to hurry up. So I just left the Chicago. I just left the Chicago prostate cancer screening. Next slide. We have a social media team. So our students and residents actually manage our social media team. Next slide. Instagram account. Please take a picture of this. please follow us on Instagram for all information. And we also do spotlights of urologists, Black urologists in the community, so you can get to know who's near you. Next slide. And this is our website, blackurologist.org. Please go to our website for more information. Next slide. And affinity groups are good for connectedness and camaraderie. A lot of times you feel like you're by yourself, but you're not. And it's a huge stress reliever to know that there are other people that look like you, that feel like you, and that have succeeded in urology, and you can too. Next slide. I want to take a minute and talk about Prospect, which I'm one of the founders of Prospect. 5 universities: University of Michigan, Henry Ford, Cleveland Clinic, Ohio State University, and the University of Wisconsin. Every year we take one student, we teach them research, we give them a summer research fellowship. It's a paid stipend of $5,000 over the summer, and we expose and engage medical students in the first and second year into urology. It's an excellent opportunity. We open up applications in October. The deadline is always MLK Day. If you hear about Prospect, I'm telling you, it is the best. Next slide. Last year, we had 5 students. Of one of those students, Markeisha Miles, actually had her abstract accepted into JAMA for a paper. Our other students have participated in the Society of Women in Urology. Our student, Susanna Wayne, presented at the AUA in San Antonio. It's an excellent opportunity to get involved in urology, have your summer paid for, be exposed to some of the greatest lecturers and professors in urology through our web lecture series, and get your hands and understand research. I can't talk nothing more about Prospect. So Prospect is awesome. Next slide. This is Dr. R. Frank Jones, and a quote by him is that his modest contribution to medicine during a lifetime of racial discrimination is that he can take comfort in knowing that he provided much wider opportunities to help forge for the present and future generations of Black physicians. Next slide. Thank you, guys. Thank you, Mady. Thank you for allowing me to be a part and tell you a little bit about R. Frank Jones. Changes ahead. Thank you so much, guys. Any questions?
Thank you so much for sharing. And it sometimes looks and feels like a whirlwind of information, but just having all these resources and knowing what's out there is so incredibly important. It's once you know where the website is, the Instagram, the Twitter, it's easy to follow, but if you don't know what's out there, it's hard to take advantage of the wealth of opportunities that exist. And I see my friend and colleague, Dr. Cassandra Saila. Hello, hello, Latinx in urology.
Yes, hi everybody, thank you, y'all. I'm one of the PGY3s at Cleveland Clinic, and so Latinx in urology actually came about when I was in your shoes, and it was really a social media platform where we're trying to connect Latino physicians together. When we started this, Jessica Delgado and I, another resident at the University of Miami, we really didn't know any other Latino physicians. We had great advocates and mentors in urology, but no one that looked like us. So that was really the genesis of this. We found each other on Twitter, and we were so excited to meet each other, and for the first time to see another person that looks like you, interested in the same thing that you are. So that's where it really created Latinx in Urology. It's really like a social media platform where we've done like physician spotlight series. We've also worked really, really closely with Urology Unbound. So you'll see me a lot of that, the panels that Dr. Chanel Wilson, puts together, and Juan Andino as well. Our goal is really to help you be successful. I think my passion is to make sure that we have continued diversity development and diverse urologists in this country. So, Latinx in urology is really right now more of a, not as established as Urology Unbound and things like that. We started as medical students, and we're residents now, so it's only just growing. Recently, the Hispanic Urological Society of North America was actually created. So I encourage you guys to sign up for that, and hopefully next year my goal is really to grow Latino Latinx in urology and expand and work with them to kind of really get the medical student component. They're really the professional and resident component. I'm hoping to work with them and expand the medical student. Get you guys to match and be successful. So please reach out.
Thank you so much. And I think probably one of the only a few groups that I think for the future, I'm going to share feedback for the program out loud. One of the other fantastic organizations that has a lot of resources, holds webinars, holds kind of peer-to-peer mentoring sessions is the Society of Women in Urology. I know a lot of folks were able to do that small groups, session at the end of the day yesterday in the evening. We don't have somebody from the organization. We have many members here, but we don't have one of the leadership presenting or sharing the link. But that is another fantastic group to share on Twitter, to go on their website. Student membership is free. And usually at every section at the AUA and at many of the subspecialty meetings now, for example, the Sexual Medicine Society of North America, there will be a SWU component or at least a reception, a networking meeting. So there's really just a great number of different programs that all have the same overarching goal. And they're working across different areas, on the student side for mentorship. And then more and more, we're trying to develop, hopefully, longitudinal platforms so that as people transition from students to being residents to fellows to faculty, these kind of networks of support continue to grow and develop.
And what's going to happen over time is you guys are going to